present. Good morning to all here. मी आज असं म्हणेन की तुम्ही अर्जुनासारखं व्हा. अर्जुनासारखं व्हा म्हणजे त्याचे कॅरेक्टर तुमच्यामध्ये आणा. तर ते कॅरेक्टर कोणते? डिवोशन, प्रिझर्व्हन्स, ऑब्झर्वेशन स्किल, हिज प्लेजर अँड हिज adaptability. All this character you must grow in you. तर हे कॅरेक्टर तुम्ही कशासाठी ग्रो करायचे हे महत्त्वाचं. आणि ग्रो करताना आपल्याला एक श्लोक आहे भगवद्गीतेचा लास्ट स्टांजा, यत्र योगेश्वरः कृष्ण यत्र पार्थ पुनर्धरः तत्र श्रीर विजयो भूतिर्ध्रुव नीतिर्मम. तर तुम्हाला कळलंच असत मे बी, तरी पण मी एक्सप्लेन करतो. यत्र योगेश्वरः कृष्ण means the Krishna, Lord of Yoga. Yatra Yogeshwara Krishna. Yatra Partha Dhanurधara means whenever there is Arjun with his bow and arrow, the man is only an instrument for a god to indicate or to reach his success. माणूस हा एक फक्त माध्यम आहे देवासाठी, त्याचं जे डेस्टिनेशन कंप्लीट करण्यासाठी. So we are only an instrument for a god. Tatra Shri Vijay means if there will only be Shri means success and Vijay means victory. Bhutir Dhruva Nitir Matir Mamma means good value, good moral. Sanjay one who narrates this stanza for the king in Bhagavad Gita. तर याचं म्हणणं असं की तुम्हाला जर सक्सेस मिळवायची असेल तर तुम्हाला तुमचं स्किल डेव्हलप करावं लागेल. आणि तुम्ही ज्यावेळेस तुमचं स्किल डेव्हलप कराल त्यावेळेस देव तुमच्या थ्रू ऍक्ट करतो, देव तुम्हाला यूज करतो. आज आम्ही क्लिनिकमध्ये बघतोय की प्रत्येक पेशंटचं पेन कमी होतंय, पेशंटला त्यांचं लाईफ स्पॅन वाढतंय. हे का होतंय? कारण सरांनी तेवढं तुमचं स्किल डेव्हलप केलंय. जर तुमची इच्छा असेल की देवाने तुम्हाला यूज करावं त्याच्या डेस्टिनीसाठी, तर तुम्ही तितकं तुमचं स्किल डेव्हलप करा. याचा अर्थ असा नाहीये इफ यू मेक मिस्टेक देन गॉड इज ऍक्टिंग थ्रू यू. तुम्ही चुका करताय मग देव तुमच्या थ्रू ऍक्ट करतोय असं कधी होणार नाही. तर तुम्ही तुमच्या मॉरल्स, इथिक्स, गुड व्हॅल्यूज जपून ठेवा. सो टुडे वी विल लर्न द चेन which allows the flexibility, protection, gives your body structure and support, allow you to control your movement. That we all knows our spine. What is spine? What does it act? What spinal cord do? What does spinal cord located? What are the main parts of spinal cord? Which condition injuries can affect the spinal cord? How can I keep my spinal cord healthy? These all questions are definitely clear in this session. आणि माझी एवढी खात्री की तुम्ही आज तुमचा स्पायनल कॉर्ड नक्कीच सेन्स कराल. And according to Indian culture, any good deed is being accompanied by the name of God and praying them. I heartily requested our student and sir to pay a tribute to our master Dr. Hahnemann sir by offering the flower and lighting the lamps. तर
तिन्ही कॉलेजचे विद्यार्थी आपल्याकडे आज. इट्स गुड प्रिव्हिलेज फॉर अस. इथापे कॉलेजचं एक जण कोणीतरी पुढे या व्हॉलेंटियर, एक जण SPSMCचं आणि एक जण MHFचं. पटकन एक जण कोणी पण तुमच्यापैकी एक जण आणि आपलं हॅनेमन सरांना ट्रिब्यूट व्हायचं. And then we start. Go on. Come on. Take it. Photo. No one takes the. exactly on time. We'll start our session. A very warm welcome from the Divine School of Homoeopathy for this specific session. And today we're going to learn a lot regarding the spinal canal disorders and homeopathic management. So many thanks to all of you, because of you it is possible to conduct such a seminar and to deliver whatever I know and whatever I know regarding the spinal canal disorders, and that spinal canal disorders, what they are, what I learned, what I know and how I treat. All those things we're going to discuss in today's session. My gratitude towards my Guru Dr. Nitin Bagli sir, who is an orthopedician in Pune, having a Bagli Institute of Orthopedics, and with whom I have learned 2 years and consecutively whenever I was in 4th year and during internship period. Complete 2 years I was with him, and because of him, whatever knowledge I have gained, it is there. It is because of only him, whatever I am going to discuss it with you, it is completely important in me because of him. So, because of him, the sessions I want to conduct, and because of this fellow, we are gathering together. And that is our master, Dr. Samuel Hahnemann, and who has developed certain footsteps towards the homeopathy of making experimentation throughout his life. And what I think specifically is what I learned from Hahnemann sir is that to do experiments. In my practice, I used to do a lot of experimentation. I have not followed just whatever Hahnemann sir have said. No, I am doing experimentation. What I feel is it's better for us. I used to experiment. I find results. I used to continue, and I used to share with me. So today I am going to share such things with you, and you are going to learn certain aspects which are not there in our homeopathy. So today's topic is spinal canal disorders and their homeopathic management. The figure is there in front of you. There are certain, you will going to get that there are cervical vertebrae, thoracic vertebrae, lumbar, sacral and fascic. But there is one word above that. What is that? That is clivus. What is clivus? What happens whenever we used to learn the spinal canal disorders, we learn directly from cervical spine, but above that, from where the spinal cord starts, is the clivus. This is the base of the brain. This bone is there, and from that bone, the whole spinal cord, the cervical spine, then the thoracic spine, lumbar spine, the chain starts right from it. So this is bone at the base of skull near the spine. Functionally, the clivus is separate the nasopharynx from the brainstem and posterior cranial fossa. It serves to support the portion of pons. So this is very important bone from where it starts. There are few chairs, I think, on last side, if it is available. Okay. Prerna, if anyone comes, Prerna, कोणी आलं त्यांना जर चेअर नसतील तर पुढे बसायला. Okay. So whenever we have to learn spinal canal disorders, we have to learn regarding the human being, and human being, whenever we have to learn both the aspects, the physical as well as the psychological, mental. One is visible to your naked eye, visible. Invisible is interior. And both things you have to learn. Unless and until you learn both of them, it is not possible to come to the right remedy. And that's why today we are going to learn both the aspects of it. So, dynamic human being, there is one thing, vital energy, vital force, which we have learned. I'm not going to talk about vital force, vital energy in today's session because today is not the organum lecture. But these are the things which you have to take into consideration along with mind and logic when you have to deal with the patients. And that's why this also plays one part in the prescription of spinal canal disorders. We'll go a little bit fast. Why there are lot of spinal canal disorders? Spinal cord generally is the backbone of your practice. And it is really a backbone of human being, both things. Homeopathic practice always depends upon the spinal canal disorders. If you start practice, you will find nearly about 50 to 60% cases in your homeopathic practice, they are related with the spinal canal disorders. Because there are two types of peoples which remains in this modern era. The first type of patients who are from the farm, who used to work very hard, who are farmers, who are heavy workers, and because of very severe heavy work they used to do, they suffers a lot from the spinal canal disorder. We have conducted generally a camp nearly about 17 years, 18 years in the complete village area where people used to stay over there and do the very hard work. And I have seen that 90%, 80% patients, they were coming for these disorders, the spinal canal disorder. Because they used to keep a very high weight on their head, they used to do continuous forward bending work, they used to do a lot of field work where very hard work they have to work out, and that degenerates their spinal cord, ultimately ending with the disorders of spine. So this is on one side, and when you go to the cities, exactly opposite of it is there. Like you are sitting on chair, you are sitting in front of your desktop, you are sitting in front of your laptop, and most common disorder of youth is the cervical spondylosis because of mobile. Because everyone is looking like this continuously. This is another thing which causes a disorder. So two opposite phases creates a spinal canal disorders, and that's why those who used to work very hard always suffers from spinal canal disorders, and those who absolutely don't do any work, they also suffers from the spinal canal disorders. Before going to the spinal canal disorders, we're going to learn certain anatomy, and anatomy is very, very, very important. Without that, we cannot go ahead. Generally, people think that we can prescribe the remedy. No. If you know exactly the anatomy and physiology, then you can prescribe the right remedy. And that's why we'll just have a short look towards the anatomy. There are 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar, 5 fused sacral, and 3 coccyx. This is the vertebral column. On that side, you can see that curvature of the spine, that we're going to learn why, that also I'm going to share with you. And this is the anteroposterior aspect. What you look for towards you is the spine, that is the posterior side of the spinal cord, and the anterior goes over there. So this is the vertebral column, and this human being, the natural posture of the spinal cord is given. Why it is important? It's a chair असेल ती मध्ये सावरली. मोकळ्या चेअर असेल तर चेअर. पाठीमागे पण चेअर. त्या चेअर असतील तिकडे. बॅक नका ठेवू. बॅक. Okay. See the normal curvature of the spine. These curvatures we must know, and we must know the scientific names of them. What is called as a kyphosis, what is called as a lordosis. If we talk with the language of modern people, the modern people, the allopats accepts you. Keep it in your mind, this is too important. If you know the exact what is meant by kyphosis, what is meant by lordosis, and then if they talk, we can understand, and if we talk, they can understand. And that's why there is a need to have a communication in the modern scientific knowledge. So there is cervical vertebrae, there is a lordosis bit. What is lordosis? Lordosis means the things which are convex anteriorly and concave posteriorly. So convex anteriorly, this is convex, the posterior side is concave. This is what is called as lordosis. Cervical spine is always there in the lordosis. Then starts the thoracic spine, exactly opposite, which is called as kyphosis. Kyphosis is concave anteriorly and convex posteriorly. Again lumbar opposite to it. Lumbar, it goes lumbar with the lordosis. The like a cervical vertebrae, the convex anteriorly and concave posteriorly. Sacral, it goes again to the kyphosis. And this is the structure of the spinal cord. This is normal structure. Just observe, in standing position this is maintained. But when we sit, whether we sit in this manner, what do? We do exactly opposite of it. We sit like this. Actually we should sit like this, but we never sit. We sit like this. So thoracic spine, in which there is a kyphosis, that is convex anteriorly and concave posteriorly, we do exact opposite. We sit like this. We do. This is the reason the people starts very early in their life suffering from the postural backing because of incorrect posture. So anatomy, if we know, we can clearly diagnose, yes, this is the posterior, this is what is there, the postural backing is. So these curvatures should be followed and we must know in detail. Then there are 7 cervical vertebrae, thoracic 12, lumbar 5, the sacrum 5, Q's and coccyx 3, called as tailbone. So abbreviations are C1 to C7, T1 to T12 or D1 to D12. T or D, dorsal vertebrae it is also called as. That's why either it is thoracic or dorsal vertebra. So D1 to D12, lumbar L1 to 5, L5, S1 to S5, sacral and coccyx, there is no abbreviation used. Now we will see just anatomy of the vertebra. So this is what vertebra is there. The first number, that is vertebral body. Number 2 is called as spinous processes, which are posteriorly there on what we feel on back is the spinous processes. Then number 3 is transverse processes, where one vertebra is connected with the another vertebra over there. Then there is a pedicle where exactly the joint is there. Then fourth is pedicle, the fifth is foramen and through which the spinal cord goes. And lastly the articular processes where one vertebra joins with the another vertebra. This is the structure of vertebra. Why we should know? We must know it because we must know exactly where the disease is. We have to understand what disease is and where disease is. For that purpose, it is necessary to understand. In between the vertebra, there is a intervertebral disc. So during flexion, how it gets pressed, and during extension, how it gets pressed, that has been mentioned over there. This has a jelly-like consistency, and because of which, whenever we run, whenever we walk, whenever we jump, whenever we climb, sits down, up, gets up, during that process, whatever the jerks are there, they get absorbed. It works as a shock absorber in our body. Because of which, we never suffers generally immediately with degenerative disorders. Degenerative disorder starts after 40 years, 50 years of age. Nowadays, they happens to be early. But these discs remain in the jelly-like state till 40 generally. And if it remains in that state, a person never suffers from degeneration very fast. To prevent the degeneration, this intervertebral disc is there. This is how the facet joints, where the one vertebra is attached with the another vertebra, then vertebral body and disc. See, this is how arrangement is there. Vertebral body, the facet joints, how one vertebra gets attached with it. And even though you bend forward and whenever you are going backward, they have that much of capacity to bend and to bend back. It never gets detached from that, and because of which our spinal cord always remains to be in a straight position. This is disc. This is intervertebral disc. The outer side of this disc is thick. That is what is called as annulus fibrosus. It is made up of fibrous tissue. And internal part, which is called as nucleus pulposus, is jelly-like. Actually, it is jelly-like, and it is covered from all sides with the fibrous tissue, and because of which it never comes out of the place. It protects that jelly. So this is the disc. Now we'll go little bit forward. This is spinal cord and nerve structures. From every vertebra, every joint, the two types of nerves, one from right side, one for another side. It comes out of there. Those are called as peripheral nerve roots, and from nerve roots there are nerves comes out. And then this is vertebral body. Nerve root you can locate over there. Why we must know nerve root? Because whenever the disc gets prolapsed because of some reason that we are going to learn in disorders, that presses that nerve root, and whatever nerve root gets pressed, that side you get the pain. You say sciatica is there. So nerve root is the basic place where there is a problem arises whenever prolapse intervertebral disc happens. And for that purpose, nerve root whenever gets pressed, it becomes a foreign body, and whenever foreign body comes over there, body reacts with inflammatory reaction, and there is a nerve root edema. Around that nerve root, severe edema comes, and because of edema, the pain gets doubled. Whatever pain is there, patient always comes. Whenever sciatica is there, patient never comes. Doctor, I have sciatica. Patient is in agony. Patient is having very severe pain. That agony is there not only because of that pressure, it is because the secondary inflammation which develops because of that foreign body, and both of things creates a severe pain over there. So we must know that nerve root edema, we should remove the nerve root edema, and what we have to do for that we are going to learn in today's session. So spinal cord, from spinal cord the nerve roots arises, and from nerve roots the sciatic nerve develops from getting it together. So there are 31 pairs of spinal nerves, 32 vertebrae are there, and in between there are 31 pairs. So cervical 8 pair, the thoracic 12 pairs, lumbar 5, sacral 5, and coccyx 1 pair. So this is how the nerve pairs comes out from the vertebrae. These are the ligaments. You'll consider, sir, what is the use of anatomy? We are going to learn, we have learned. No, we have learned only for example. We have not learned it from deceased point of view. Why we must know the structures? If a case of lumbar strain comes, where is the strain? Strain is in these ligaments. This ligament is strained. A ligament फाटतं, ताणलं जातं, and then there is a disease. If it is there, what type of remedies which we can think or we can go ahead, that we have to decide. For that purpose, it is so much necessary to know the anatomy of it. So see, there is on the anterior side, there is anterior longitudinal ligament. From the posterior side, there is posterior longitudinal ligament. So vertebra is there, the body is there. Body च्या पुढून काय? What is there from body? Anterior longitudinal ligament. From posterior side of the body, there is a posterior longitudinal ligament. Then between the two vertebrae, there is again a ligament because of which it never disturbs its position, which is called as intertransverse ligament. Then from the body, the posterior side, and then from the in between the spinal cord on one side, there is a ligamentum flavum is there, and then the facet capsularly ligament, that is the facet joint around which there is a ligament, and then lastly the supraspinatus ligament and interspinous ligament. These ligaments are there because of which our spinal cord remains straight. It never gets disturbed. It never goes on right side, left side. It remains straight because of the strength of the ligament. And ligaments are the very important structures. They are made up of the fibrous tissues, and they give a lot of support to the spinal cord. If there is a ligamental injury, it always disturbs the position of the spinal cord, and that's why we must know the ligaments. What are the functions of spinal cord? The most important is the protection to the spinal cord, nerve roots, many internal organs. Then the base for the attachment, it is the ligaments which gets attached, there are tendons which gets attached, then there are muscles which gets attached. Then structural support to your head, to your neck. It is because of the spinal cord. So shoulders are there. They are attached to the spinal cord. Then third is the balance and weight distribution. Because of spinal cord, we get balance over there. Flexibility and mobility. So we can do a flexion, forward bending. We can do extension, backward bending. Then side bending. Both sides we can bend. It is only because of this flexible spinal cord. Then the combination of all those things we can turn like this, we can do this, everything. It is only because of this flexible spinal cord. So rotation to the right, rotation to the left, and lastly bones produces RBC, and they are big source of your mineral storage. These are the very specific functions of it. So this is the introductory part, and I think it is a revision for you. If you have read, this is again a revision. Now we'll turn to the clinical part. And spinal canal disorders, most common disorders in homeopathy, OPD and IPD. What is IPD? And how IPD is there, whether there is homeopathic IPD. We have seen the homeopathic OPDs, we never seen the homeopathic IPDs. Because generally we never look toward the patients with these suspects. We never consider the disease properly, and we never use the IPD for the patients who are suffering from spinal canal disorders. And there is much need whenever certain disorders are there. So IPD is a very, very important in treating certain disorders. If there is a case of prolapse intervertebral disc with very severe spinal canal pressure over the spinal cord and severe sciatica, the need is there to admit the patient. Generally, we give the remedy, yes, there is colosine, give it, and it never works. Because we have not understood this is what we are treating. And for that purpose, IPD plays a very vital role, because we used to do homeopathic management and not the treatment. In my setup, I used to do homeopathic management with each and every patient. Management is rather different than the treatment. Giving a remedy to the patient is a treatment. But managing a whole case, taking into consideration every aspect, is called as a management. And what today we are going to learn is the management. So there are two important parts, the treatment versus management, and where homeopaths lack is in the management. What do we do I have seen a number of homeopaths. Yes, they have made very good prescriptions in their practice. But many times they fail because they have not managed their cases properly. And where we lack is generally at the clinical level. Clinical side we are completely lacking. How many of you have read the Hutchinson's clinical methods book? I will going to ask a question. We never read. Why? It is the part and parcel of your syllabus. From second year you have clinic, second year, third year, fourth year internship. You have to read the Hutchinson, you have to read the Chamberlain, you have to read the clinical methods by K. Das, clinical surgery. But we never read it, and we miss the clinical examination. We never understand the patient clinically, and because of which we fail in many prescriptions. Even though our remedy is right, we cannot give the right results because we cannot manage the disease. So today we're going to learn more practical. So it's not the seminar, it's a workshop actually. It is theoretical part I will take little bit, but I will try to elaborate the things practically in today's session. Okay? So today is most practical day, I think, for you. You better you tell me at the end of seminar. But before going to that, my approach towards spinal cord disorders and homeopathic management always starts with my subject, that is organoids. Why I have said? Because there is one aphorism which is called as a miniature of organoids. Which aphorism? The third aphorism is called as miniature of organoids. And what he has said over there? He has said over there that you must have certain knowledges when you are becoming a true practitioner of healing. And what those knowledges are there, the one part of it, two parts of it today we are going to learn. And before that, two words Hahnemann have written on the 6th edition of Organon, on the first page only, that is audacity. Dare to be. Why? He has written it because he has experimented and he has coming out with his own ideas and which were absolutely new to the fraternity. I used to use the same words whenever I deliver the seminar, because whatever you are going to learn in today's seminar, I am there to be wise, because whatever I will going to tell you is my experimentation, which is going away from little bit Hahnemann, which is going away from your own concepts which are there in your mind, and you are going to learn something which is absolutely new. And that's why these two words I used to use. This aphorism, there are two important things which I have highlighted. First, knowledge of disease, indication, and knowledge of medicinal powers. Rest of the things today we are not going to learn. But what these two words means, that is very important. Knowledge of disease, indication. What Hahnemann expects from this? He expects from this, if you are learning the spinal canal disorders, he says that you must know the spinal canal disorder as a disease. At the same time, how it is represented through indications in a specific patient is indication. So two parts are covered over there. One, you must know all spinal canal disorders which are there in your curriculum. And then how they are reflecting in your patient is an indication. And second important thing is that knowledge of medicinal powers. What is knowledge of medicinal powers? It is not just medicines here. If you are giving a patient a Rustox, the Rustox 6, Rustox 30, Rustox 200, Rustox 1M, Rustox 10M, Rustox 50M, Rustox 6M, all are different remedies. All are different remedies because Rustox 6 will going to produce a different picture than Rustox CM. You must know these medicinal powers. So in your patient, whether you want Rustox 6 or whether you want Rustox 10, what potency you are going to give, that matters a lot. Coming to the right remedy is very simple, but coming to the right potency is difficult, and that's why Hahnemann have specifically utilized the words, the knowledge of medicinal powers. Okay, is it clear? So, while dealing with the patient of spinal canal disorders, we must know spinal canal disorders in order to understand disease pathogenesis, their progress, and also the prognosis. And second part, the indications of the same disease in the individual, that is understanding the sick, the individualization. Both aspects today we are going to learn through the cases. So it's not topic of one seminar, but actually it is a workshop, and I am going to show how to clinically examine the patient and how it reflects, what it reflects in today's session. So there are 6 varieties of disorders with whom we are going to learn. The first is cervical disorder, second thoracic, the third lumbar, the sacral, the coccygeal and whole spine disorders, out of which most common are the lumbar. Most common are the lumbar, and that's why we'll start with the lumbar disorders first. Because what is common we must learn first, what is difficult we must learn later. So we'll start with lumbar disorders and we'll start directly with the first case. It is a case which was there, which I have treated in very early in my practice. I think before you have been born. That is in the 1995 most probably, or 1998. It is a case of chronic lumbar backache. Read the case carefully. He was the patient. My case paper number has been written over there. This fellow was the retired teacher, 59 years old, now working in farmer, consulted with following complaint. He came directly from the Bharati Vidyapit Hospital, Pune. He was admitted for the operation, but he got my address over there, someone told, and he has taken against medical advice, discharge from there, and directly from Pune he came to me. Was having very severe right-sided sciatica since 1 year, aggravated by lying on back, ameliorated lying on same side, aggravated by walking, aggravated by bending forward, ameliorated by warm application, and ameliorated by rest. This is the basic condition with which he has come, along with very severe numbness and heaviness in both lower extremities. So both lower extremities, they are absolutely numb and heavy. He was not able to lift, he was not able to walk this much. It was very painful for him. Patient was not able to walk few footsteps due to the development of severe cramps. So whenever he started walking like this, a little bit he walked, he started getting the pain in lower extremities. Those pains are called as claudications. त्यांना काय म्हणतात? Claudication. Claudications are there. There are only two reasons behind claudications. Keep it in your mind. Always, if patient complains. So what it means? If he is walking and he suffers, it means he has to take a rest and then he has to go ahead. He has to take rest, again he has to go up. This is claudication. So patient gets, the cramps are very heavy and patient has to sit at that place. The first diagnosis, if there is no backache, the diabetes, complication of a diabetes is diabetic claudications. And second diagnosis is always a spinal canal stenosis. These are the basic two reasons which develop the claudications in the patients. So this fellow came with the claudication who was not having diabetes. So your diagnosis is very clear that he is having the spinal canal stenosis. Okay. Past history of hemorrhoidectomy in 1994. There is a family history of tuberculosis, pulmonary tuberculosis to the father. Constitution, he was tall, very tall. He is like this, tall, slender, big, emaciated. That was his constitution with whom he came. But a good build comparatively. Personal history, thirst for 2-3 glasses of water to 3 hourly. He was craving for, having very severe craving for tobacco, salt and sweets. Sleep disturbed due to the pain. He was not able to sleep because whenever he used to change the position, he used to get a very severe pain in lower extremity as well as back. Stools, they are hard, dark, with difficulty in passing. He used to get very frightful dreams and dreams of falling from height, and thermally he was ambithermal. So partly chilly, partly hot. That was the condition. So this is the case. First important thing is that what problem arises when we get the case, we start thinking about the remedy. So what is the remedy? Phosphorus. Azul? What are the ideas? My suggestion is that don't go for remedies. There is no need to go to the remedy. First understand from what he is suffering from. Basically, if you understand from what he is suffering from, then your logic will going to work. Otherwise, it will not going to work in a proper direction. Otherwise, Brian is this, give Brian. We think, Rustox is the, we give the Rustox. And we fail. Because we never think from what he is suffering from and what type of remedy he will require. So, this was his mental state. He was quite irritable, was quite inquisitive. He asked me many questions. Inquisitive means curious. He asked me many questions. Doctor sir, याच्यात हे असतं का? होमिओपॅथीत असं असतं का? He had asked many questions. He was quite cowardice, prideful, quarrelsome. That was another feature which was there with him. He was depressed because of pains. He was quite religious. There was a tira over there on his face. And he always, he says, sir, I want to change my aspects every time. I never get fixed with anything. I have changed my profession. I stopped teaching. Then I have entered into the farm. Now I want to do business. So there was a change desire for. He never tolerates any type of contradiction. He was quite obstinate. Whatever he says, it should happen. The obstinacy was there at this age. There was anxiety about future because of his disease. What will happen to me after that? Then he was quite intelligent. Being a teacher, he was intelligent. Then he was dominating, dictatorial. Dictatorial means the way he says should be happen. He was, even in this age, he was having fear of dogs. That is characteristic. At the age of 59, if you have fear of dogs, it is always characteristic. In children, it is again children, it can be possible, but when you, in the old age, if you have a fear of dogs, then it has significance. He desires to travel a lot, and last point which he has mentioned is, there are many business thoughts. That's what he was thinking, I want to do a business. So this is the case. And this fellow, he has consulted number of orthopedicians within these days. Everyone asked him to go for surgical intervention. Has done homeopathic treatment from one homeopath for 1 month without any result. He has received bryonia, he has received rustox, he has received causticum, he has received naphthalum, he has received strontium within a month without any result. So this is the case. Why these homeopathic medicines have not produced any relief? That is the first question. Bryonia, not worked. Does anything necessary more than that? What is the disease in the patient? What is the diagnosis? And last point, it is said that in homeopathy diagnosis is not important. Is it right? These are the questions which always troubled me a lot. Both things. Whenever I used to think about diagnosis first. You have to diagnose the case. Diagnosis is so important that you must know what you are treating. If you don't do a diagnosis and you give a remedy, yes, many times it might work, but many times it might fail. Because you don't know what you are treating. In this case, you must know the diagnosis. What is that? So, first we are going to learn all the lumbar disorders now. I will not tell you the prescription. First, I will tell you all the disorders, and after learning that, you tell me the diagnosis. Is it okay? What we will do, I am not going to tell what prescription is given. So there is one more question to you. Does investigations have any role in homeopathic science? पहिला प्रश्न आहे का नाही? काय? What is the use? What is your opinion? How it helps? If we do the MRI of this patient, how it helps? Does it help? If we don't do MRI and we prescribe, why it is necessary to do an investigation? You cannot come to conclusion exactly what you are treating without the help of investigations. And if you don't do investigations, if you treat and if you fail, you are blamed. If you have done the investigations, you know the diagnosis, and then you have prescribed and you failed, you are not blamed. So it is your duty to go for investigation, ask the patient to do all investigation, come to the right conclusion and then treat the patient. That will be better for you always. So you will not give a chance for another people to blame you. That is most important thing. So it is so much important to do a differential diagnosis and understand all spinal disorders. So first we'll do a differential diagnosis and then we'll come to the conclusion. There are these varieties of spinal canal disorders. One picture, everything is located. What is first? There are two vertebrae. There is a normal disc which you can observe. This is normal disc. When disc starts degenerating because of aging process, it degenerates like that. When all of a sudden you lift up something, sometimes the disc bulges out. It is called as bulging of disc. Then the annulus fibrosus gets torn and the nucleus pulposus comes out. It is called as herniated disc or prolapsed intervertebral disc. Then because of degeneration, the thickness of the disc comes down in the old age. That is what is called as spondylosis. That is thinning of the disc. Disc becomes thin, and when it becomes so thin that the vertebra itself starts getting degenerated and it develops on sides. You can see, or you can locate over there, you can see the osteophytes formation. Are you getting that? These are called as osteophyte formation. These are osteophytes because of directly gliding one vertebra over the another, producing that osteophytes. This is when osteophytes are formed, it is called as spondylosis. Spondylosis means degeneration of the vertebra, intervertebral disc, with the production of osteophytes. कळालं? So these are the spinal canal, lumbar canal disorders. So first is disc degeneration, then the bulging of disc, then the herniated disc, the thinning of the disc, and lastly the lumbar spondylosis. We are going to learn one by one. This is simple. We have learned the anatomy. At first we have learned the anatomy. We have learned there are ligaments supporting that. With one simple entity with which patient comes always to you, and they talk in their own language. Okay? They comes to you when they talk in Marathi, they use one word. Doctor, usan भरणे. What is usan भरणे? आपण इंग्लिश मध्ये बोलतो lumbar strain. It is nothing but the same thing. Why it has happened? All of a sudden, patient lifts up something, he stretches his back sometimes by pushing something. At that time, these ligaments little bit strained are called as lumbosacral strain or lumbar strain. Most common entity in our practice. Elements from sudden lifting anything or jerk, sudden pain and stiffness in lumbosacral area, and diagnosis is clinical. Diagnosis is clinical. म्हणजे काय? How will you examine now spine, lumbar spine? Now we'll go to something else. Gaurav, please come. Give him a big clap here. He's waiting for the volunteer. Lie down. Whenever you have to examine any patient, and if you are right-handed, you should be on right side of your patient. तुम्ही त्याच्या उजव्या बाजूला असाल. Whenever you have to learn, you have to check the lumbar spine. Ask the patient to lie down on tummy. What you will do first? Simple. Ask the patient to lie down like this, and you will start checking each vertebra right from the lumbar 1, L1 to L5 or S1. So you just press from lumbar, you must start it from lumbar You just check and see whether the patient is having any tenderness. If there is a tenderness, if तुम्ही दाबलं, if you are pressed and patient complains of pain, it means there is a strain. It is a pain on pressure is a tenderness. So here the patient, if lumbar strain is there, you just check this and patient is having, yes doctor, this is the site. If patient says, doctor, this is the site where I am getting the pain, he denotes with his hand, doctor, this is the site I am having very severe pain. This is the site. Then you ask the patient to lie on back. First, lie on back. Do 2 tests. Don't test correct. कुठले? Sir. First test is called as straight leg grazing test. Straight leg grazing test. SLR. Simple. Ask the patient to lift the right leg up. Keep it down. Then left leg up. Keep it down. This is straight leg grazing test. If the patient starts getting pain, if it goes, he is not able to lift it more than 45 degrees and he yells with the pain, patient chinsarto, it indicates there is a sciatica. There is a nerve roots getting stretched over there and he is having nerve root edema, he is having pain, it indicates that he is having prolapse intervertebral disc. Now this fellow, where the lumbar strain is there, SLR is negative. Clinically, SLR is negative, it is definitely not having anything. There is one more test which you have to do. Ask the patient to lie down on tummy. Just see, this is पूर्ण काय करायचं? You lift his leg, bend it at 45 degree, 90 degree, and just keep your hand over there and lift this up. This is called as femoral root stress test. FRST, femoral root stress test. Where femoral nerve root gets stressed, if patient is having this, he yells with the pain again. So he yells with pain. If this test is positive, again he is having the definitely a disc prolapse. These are 2 important diagnostic tests which one must do whenever you are examining the lumbar spine. लंबर स्पाइन चेक करताना 2 टेस्ट नेहमी करायचे, एक SLR आणि एक FRST. If you do this, then definitely you will find whether is there any problem with the disc. If it is not there, your diagnosis is very clear. This is just a lumbosacral strain. Patient is talking same sense, Dr. Hussain Barli, कंबर लचकली. These are the number of common words with which patient approaches to you. So this, if this is there, how will you treat? काय करणार? Does it a chronic disease? No. It is an acute. So your remedy should be acute, which will cover that. So you have to think about the remedies. That we are going to discuss after these 2 things. There is another disease with chronic lumbago. This is not acute, this is chronic lumbago, where there is a fibrositis. So ligaments and joints over there, they get fibrosed. Patient, doctor, खूप कंबर. They always talks. There is severe backache. The continuous type of pain is there. It is not positional. It is continuous. कंबर दुखती. He is always talking like this. When you ask the patient, he says continuous दुखती. It is there continuous. So continuous pain. Third is, again the diagnosis is clinically. Clinically there is a pain not only on vertebra, the around sides of the vertebra, that is the paralumbar region. Patient always complains of a pain over there. So that is what is called as a fibrositis. It is chronic. The earlier disorder was acute. Third is prolapsed lumbar intervertebral disc. मगाशी आपण पिक्चर मध्ये पाहिलं होतं. There is a prolapsed disc. That again we are going to learn. Why it happens? Disc prolapse झाली, बाहेर पडली. Why it happens? Why this disc comes out? Elements from sudden jerk or sudden lifting the weight. Sometimes it happens, patient is in a position and all of a sudden he got very severe sneeze. That pressure also sometimes produces the prolapse intervertebral disc if the patient is weak. Sudden sneezing, sometimes severe cough can produce it. That is also, those are also uncommon but indication for it. Signs and symptoms: sudden lumbar lumbosacral backache associated with unilateral or bilateral lower radiculopathy. Radiculopathy means pains along both the lower nerves, both sides. If it is there, if it is on one side, you can get it on one side. So right sided sciatica, left sided sciatica, or sometimes bilateral sciatica. These are the things which develop because of prolapse or intervertebral disc. If it is pressing right nerve root, you will get right sciatica. If it is pressing left nerve root, you will get left sided sciatica. But if the disc is central, then you will have a bilateral lower extremity pain and numbness. So radiculopathy, where the nerve is at fault, associated with numbness, associated with tingling sensation, associated with heaviness in the lower extremity, always thinks that it is associated with neuropathy or nerve affections over there. Last sentence and the meaning. It may lead to paraplegia also. Sometimes it is so severe that patient might get a paraplegia because of the severe disc problem. So that is also one of the entity which can develop because of it. Diagnosis is clinical. Patient ने जी history सांगितली, whatever the patient has told the history, you can find it out easily, very easily. Second important, just now we have learned SLR, straight leg raising test. The second test also we have learned, femoral root stretch test. If both of them are positive, you are damn sure the patient is having the disc prolapse. X-ray lumbosacral spine epilateral never gives you any idea. Because changes in the X-rays, it takes 2 to 3 years to develop. It never happens so suddenly. So structural changes, you cannot find it out with the plain X-rays, epilateral, even though you have asked it properly. If you want to do a lumbosacral X-ray, what you will going to advise? Patient ला सांगायचं X-ray करून येऊ द्या. What you will going to advise? काय करणार? चिठ्ठी देणार? What you will do? What you will going to write? You will going to write X-ray LS spine epilateral, but before that you have to ask the patient that you take 2 tablets of Dulcolax, 2 tablets of Gasex, and you take it today night. Tomorrow morning you will have loose motions. Then gas will pass. Everything will be clear. Don't take anything from mouth, nil by mouth, and then he should go for X-ray. Then that X-ray will going to tell you, give you exact idea. Otherwise, X-rays, if there are gas shadows, if there are feces over there, you will not going to get clear picture of lumbosacral spine. So, giving enema, giving laxative, purgatives earlier days, and then you have to ask the patient to go for X-rays. Right, Laksha? So, no X-ray is advised directly for the patient. Whenever lumbar spine or lumbosacral spine you have to do, you have to ask the patient to take these tablets. Second thing, X-rays are not diagnostic. X-ray diagnostic nahi hai. It takes long time. So, CT, it was earlier, nowadays MRI is there with us. MRI is the best confirmatory diagnostic investigation. Most diagnostic is MRI. MRI, you have to explain specifically lumbosacral spine, MRI lumbosacral spine. If you give it, previously there was one more investigation, now no one goes for it, a myelogram. Before the CT or MRI was available, there was a myelogram. Myelogram मध्ये काय करायचे? What do? They inject the dye in the cord and they used to take the X-rays. So that spinal cord was colored because of dye, and then X-rays, those used to give you a idea regarding the diagnosis. But many times there was patients are allergic to those dyes, and many deaths have been recorded. So after CT and MRI, it has completely vanished. No one goes for MRI, myelogram now. So this is how we have to go ahead with the lumbosacral disc prolapse. So what is herniated disc exactly? Now this figure diagram gives you exactly the picture of what is herniated disc. It is herniation of nucleus pulposus. So blue part in between that gets come out when occurs when nucleus pulposus gel-like substance breaks through the annulus fibrosus tire-like structure of an intervertebral disc, which is called to be a spinal shock absorber. So the annulus fibrosus gets break and then disc comes out. How it comes out is given in next picture. There is a disc degeneration, then it starts getting prolapse, then there is an extrusion that it gets torn, and then the nucleus pulposus comes out. That is what is called a sequestrated disc. म्हणजे त्याचे तुकडे तुकडे that deposits over there. That is called a sequestrated disc. The annulus fibrosus comes down and settles over there. This is what is called as a disc intervertebral disc prolapse. Is it clear? Okay, we'll go ahead. How this presses the nerve root. Let us see over there. It is very clearly indicated how herniated disc presses the nerve root, and whenever it presses the nerve root, immediately the inflammation starts. So if it is so much small, it is there, but inflammation is big, and because of pain, because of which pain is of a very severe character because of inflammation. So there comes a nerve root edema, that is called as nerve root edema. It is secondary to the sequestrated disc which comes out over there. Is it okay? So this is the disease. Her disease कळणं गरजेचं आहे. Now question is that this is a myelogram. There is one. You can find it out. This is where you find the disc coming out. The whole spinal cord is colored, and you can find it out here. It is not getting colored because disc was prolapsed. This is a myelogram picture. Okay, this simple X-ray never denotes anything. Same patients, simple X-ray never tells anything, but on myelogram you can get. If you do the MRI, you will get very clear-cut idea about it. Okay. Prolapse intervertebral disc, you must know that these are how the sciatic nerve is developed because of all the nerves getting joined over there and form the sciatic nerve. Now, my question. You know properly that this problem is mechanical. Disc bahar a problem ka? It is mechanical. Okay. So what is your answer? Is it curable with homeopathy or not? टायर पंक्चर झालाय हवा भरून पाहिजे think over it. This is very important. What do you feel? Is it curable with homeopathy or not curable with homeopathy? What you are going to do? Huh? The controversies are always there in our mind when we never think logically. Now see, this is my answer. 100%. I am saying not 90%. I am saying 100%. The reason behind that you must learn. Whenever nucleus pulposus prolapse becomes a foreign matter in the spinal cord, so there is a reaction from immune system, foreign body and antibody. There is a inflammation. Why? Whether inflammation is the disease? No. For what purpose it is there? Inflammation is always there to remove the foreign body बाहेर काढण्यासाठी असलेली रिएक्शन म्हणजे inflammation. Question is, whenever inflammation happens, there is a congestion, there is nerve edema, and therefore there is a very severe sciatica. Sciatica is there, but it becomes more aggravated. Why it is not curable with allopathic treatment? Why this is surgery लागणार आहे? डिस्कॉइडेक्टॉमी, डिस्क काढून टाकण्याला सर्जरीला डिस्कॉइडेक्टॉमी म्हणतात. काही जण ते डिस्क काढून टाकतात आणि परत दोन व्हर्टेब्रा मध्ये काहीच राहत नाही, तिथं बोन ग्राफ्ट करतात आणि दोन व्हर्टेब्रा एकत्र करतात. पोस्टीरियर लंबर इंटरबॉडी फ्युजन म्हणतात, फ्लिप सर्जरी म्हणतात. दॅट इज कॉल्ड फ्लिप सर्जरी, पोस्टीरियर लंबर इंटरबॉडी फ्युजन. But they never cures it and they says it is incurable because this they use anti-inflammatory. Whenever pain is there, their line of treatment is giving anti-inflammatory. What will happen with anti-inflammatory? Inflammation will disappear. Whether you have removed the disc which is coming out, you have not removed that annulus fibrosus. What will happen? Whenever the action of that anti-inflammatory vanished, there will be again inflammation. So acute inflammation gradually becomes करावा. You have to go for surgery, then your problem will be solved because the treatment is only surgery. What homeopathy we are going to do? What is the result of acute inflammation is phagocytosis. What are the sequelae after the phagocytosis? That is called as resolution. It degenerates that complete disc. It has been completely disintegrated by the structures, by immune reaction, and that disc is completely vanished with the help of homeopathic remedy. Because homeopathic remedy, where it acts in the dynamic plane. It just stimulates the immune system. Your immune system is already working. That's why it has produced the inflammation. What you are doing? You are stimulating that system. What it will do? It will go for phagocytosis. It will that structure is completely getting disintegrated, and thereafter the complete resolution. It has been taken away from that place. So, with the help of homeopathic management, you dissolve that with your remedy. But it takes a little bit longer period. It is not within a day. It takes a year. Then that disc will be completely disappears from that place. It is disintegrated, degenerated, and taken out. This is 100% resolution, and patient can get cured completely with the help of homeopathic. So, spinal canal stenosis, because of this degeneration, spinal canal stenosis, because of osteophyte formation, you can treat with the help of homeopathy. The disc which is completely taken out in this manner, and patient can be cured. If osteophytes are there, there is no remedy in allopathy for osteophyte formation. What do? They ask you, go to the physiotherapist. Because there is no medicine to dissolve the osteophytes. With homeopathy, we have the very good remedy which has capacity to dissolve the osteophytes. Which is the remedy? It is Calcarea pure, which has capacity to dissolve the osteophytes, which dissolves the osteophytes, and patient can come out of it. So we have all solutions for them. Okay, so how to manage acute case of prolapse intervertebral disc? First thing, hospitalization, absolute bed rest, and continuous lumbar traction. What is lumbar traction? Question arises. Many questions are there. Don't you feel this is allopathic? There are many students ask, this is allopathic. Is it allopathic? It is not allopathic. Whatever you are doing is auxiliary measures in order to support your patients. What fomentation? Every point we must know why there is a need of continuous lumbar traction, what is the use of absolute bed rest, what is the use of hot fomentation. Hot fomentation, whenever you are going to ask the patient, keep it in your mind, it should be dry heat, not moist heat. What should be there? It should be dry heat. म्हणजे काय? What it means? Patient should not use hot water bath. That is moist heat. Dry heat म्हणजे काय? He should use a pan which is hot, keep his clothes over there. With that hot cloth, he should apply that hot cloth. It is a dry heat. Or he can make a warm or hot sand, place it under some bag and keep that bag under this. This evaporates the dry heat. Third thing, even there are electric heating pads are there which can develop a dry heat. For any muscular problems, disorders, you should not use moist heat. You should always ask the patient, they should make it with the hot dry heat only. Hot fermentation with dry heat only. Moist heat always creates a psychotic miasm. Moist heat always produces rheumatism. Damp weather produces rheumatism. Keep it in your mind. So moist heat always increases the joint problem. That's why you should not use moist heat. It should be a dry. Clear? Second thing, what is the use of complete bed rest? Ask the patient to lie down on this bed completely for 10 days. Even you don't apply the lumbar traction, it's okay. lumbar traction लावलं नाही तरी चालेल, पूर्ण झोपून राहायचं. 8-10 दिवस झोपून राहायचं, काहीच उठायचं नाही. फक्त टॉयलेट पुरतं जायला उठायचं, परत झोपायचं, जेवण करायला उठायचं, अगेन लाई डाऊन. पेशंटला तुम्ही सांगितलं, when you tell the patient take the complete bed rest, what do? They sit, starts the TV, watches the TV by sitting there. They said, I have taken the rest. This is not rest. It should be 100% flat. Flat is very important. If you sit, it is not a rest. 100% making a flat rest reduces nerve root edema 90% without any medicine. काय लक्षात ठेवा, नर्व रूट इडिमा घालवायचा असेल तर पेशंट फक्त आडवा झोपून ठेवा 8 दिवस, काहीच करायचं नाही त्याने. पेशंट will immediately get settled because 90% of his pain which is developed because of the nerve root edema, that edema disappears, the pain reduces a lot. That is first thing which you have to do. So that's why I have said over there, absolute bed rest. If hospitalization is not possible for the patient, ask him to lie down completely 8 days in his office. Certain people who don't afford the payment, it is better to ask them to तुम्ही घरी जाऊन झोपायचं, absolute झोपून राहणार असेल तर I will treat you over there. Lumbar traction is one important entity which sometimes work with the lumbar traction, but which works because of lumbar traction. It is a gel. तुम्हाला पिन तुरुंगात टाकल्यासारखं आहे. Once you apply lumbar traction, you cannot move, you cannot go anywhere. You are taking absolute bed rest, and because of which you are getting better. Lumbar traction never helps that it gives a traction for both sides and jelly again goes inside. This is only theoretical. Logically, this is possible, but practically many times it is not unless the patient is too young. 18-19 वर्षाचा मुलगा आहे, then that jelly can again go inside. That may be possible, otherwise it is not. But lumbar traction works because patient takes absolute bed rest. बेल वाजली, दार उघडायला जायची गरज नाही, कारण ते बांधलेलं आहे. And patient takes the rest. What if you ask the patient to take rest, he goes, कोणी दार वाजवलं, he goes to open the door and again lie down. Every time he wakes up, it is not called as a rest. So you have to ask the patient lumbar traction only for that purpose, that it reduces nerve root edema and early pain relief is always there because of this. And this is the purpose of hospitalization. Is it clear? मग हा पेशंट आपण मॅनेज नाही करू शकत का आपल्याकडे? 2 बेड तेव्हा 2 बेडला तुम्ही पेशंट ऍडमिट केला. इफ यू गिव्ह द lumbar traction, if patient is there, this fellow is like that. This is lumbar traction. Only wrong thing which is not with is there in the picture. Here you have to keep a bricks and it should be elevated. Lower end of the bed should be elevated at least 4 to 6 inches. Then there will be good pull on it. It should be lifted up. That is the one thing. This is the lumbar traction. This should be applied in such manner. At least 8 to 10 kg. Weight किती पाहिजे? How much weight should be there? At least 8 to 10 kg. 8 to 10 kg weight लावल्यावर तुम्हाला weight लावलंय असं जाणवत नाही. You never feel that you have applied the weight. It is, you cannot. But after some time, automatically that patient comes down. That pulls patient down. Again you have to ask, just go up. But it is gradual. It never disturbs patient or it never aggravates the patient complaint. Continuous lumbar traction always helps. There are certain new instruments are there where that instrument pulls you with 55 kg, 40 kg, those types of instruments are there, but they are troublesome. If such type of big weight is applied, sometimes there is an aggravation in the complaints because of that pull. So instead of that, better aspect is always to utilize the continuous lumbar traction. Right, Lakshay? This is the method with which it works. It stretches the vertebra, and because of stretching it on both sides, patient जो weight एका बाजूला pull करतो, वजन एका बाजूला pull करतो, so it stretches like this. This is the how it happens, and because of which there are chances that disc might come over there. But this is not the thing. Nerve root edema gets settled because of complete rest, and patient feels better. Is it okay? Yes. Okay. What is the homeopathic management, medicinal treatment? If such type of patient comes, first is simillimum depending upon presenting totality. If it is acute, present totality, whatever it may be, patient comes and says, very severe pain. It goes from this side, it goes down, and so severe. I cannot lie down. And this has happened yesterday only. I have lifted that and all of a sudden it is there. And his SLR is strongly positive. His FRST is positive. What you will do? He is not able to lie down. Problem is that. What you will do? Pain is of so severe that I could not sleep whole night, doctor. So severe is the pain. Spray, move. What do you do? Array head and no. Rustox is the remedy which gets aggravated by lying down. Patient is not able to lie down because of that pain. Right-sided sciatica aggravated by lifting the weight. This is the Rustox which your patient is explaining. Give me Rustox, give me Rustox. You are applying move. You give the Rustox in which potency? 30. No. 6. 200. Are patient is in agony? Susceptibility is very high. Potency should be very high. Repeated till the pain disappears. Give the Rustox 10 ml in repeated doses till the patient subsides. If you give 30, you aggravate the pain. If you give 30, you stimulate it again. You should match the susceptibility. Patient is of this susceptible, your remedy should be this susceptible. Then patient gets the result. Susceptibility is very high. He is in agony. Patient asks, doctor, he is not like that. No patient of sciatica comes like this. He is in agony. So your potency should be high, 10 m. So this is the simillimum. The simillimum depending upon presenting totality. Patient is settled with the medicine, and now this can happen again because his muscles, they are weak. The sprain is there, disc prolapse is there because the fibrous tissue is not having the strength. Now, if you want to prevent further problem, you have to give constitutional or miasmatic remedy. Now, for this patient, what you will be? आता या पेशंटला काय झालं? बोरी काढलं? उघडा. झोप जाईल थोडं. There is at the end there is a remedy relationship आहे का बघा? तिथं रस्टॉक्सला कॉम्प्लिमेंटरी मध्ये कल्केरी आहे बघा. There are two complementaries to Rustox. One is Bryonia and second is Calcarea, if I am not wrong. Barabar? So Calcarea is chronic. If you open the Calcarea, under the extremities you will see chronic sprains. Okay. Under the Calcarea you can see the chronic sprains. Those who don't have the books, sit together, you can see. ज्यांच्याकडे पुस्तक नाही त्यांनी एकत्र बसा, so that you can also. Under the extremities you can get the chronic sprains. Is it there? It is a very important remedy for chronic strains. It is an anti-psoric, deep-acting anti-psoric. It covers the calcium metabolism, everything. It gives the strain to the musculature, it gives strain to the fibers. So, ordered by constitutional miasmatic remedy. So, if you give the Rustox, the complementary is Calcarea, which covers the whole story, can cure the patient and prevent further problems. You have to think logically when you are treating such types of disorder. If patient is exactly opposite of it, या पेशंटच्या एक्झॅक्ट विरुद्ध, that he is not able to move the leg, he is absolutely lying in bed. If he turns, there is severe pain. He turns that side, there is pain. Now Bryonia is there. Bryonia has covered the patient. Now there is an aluminate complementary to the Bryonia. Deep acting remedy having the neurological problems. Is it there? Bryonia la Rustox पण complementary, alumina पण complementary. I agree. We must know this remedy relationship. We must think about it when we treat such types of disorder. Then we can find it out exactly what we have to do. So first, acute totality should be treated with acute remedy followed by constitutional or miasmatic, deep acting miasmatic remedy. Is it clear? This is medicinal. When pain stops, gradual walking with spinal extension exercises to prevent recurrence. Yeah. When patient's pain is settled, now you have to ask the patient to go for spinal extension exercises. What are spinal extension exercises? There are two important exercises which you must tell the patient. Whenever disc prolapse is there, ask the patient to lie down. डोकं सरळ ठेवा. दोन्ही हात बाजूला, both hands from sidewise. Ask the patient to lift the right leg up completely. Ardha Shalvasan. Keep it down. Now left leg. Take 3 breaths. 3 श्वास घ्यायचे सोडायचे. Keep it down. And now turn your leg, head towards sides. Relax your body. Just relax completely. 3 वेळा श्वास घेऊन एक पाय वर उचलला. Then you should take a relaxation. Both legs after completing. There should be a 20 seconds to 30 second relaxation. Then again he goes for that. Second thing, ask the patient to make it gradually. Today one time, tomorrow 2 times, third day 3 times, fourth day 4 times, and up to 10 days he should reach to the 10 times and stop over there. Continue with the 10. This is first exercise. This is in Marathi, or we call it Ardha Shalvasana. Okay. Second is Bhujangasana. दोन्ही हात मागे अडकवायचे and just lift the head up. Here patient gets complete strain pain over here, but this is the exercise to develop the strength in the paralumbar muscles as well as ligaments. So for taking the 3 breaths he should be up, and after that he should completely relax, taking the head on sideways and complete relaxation for 20 to 30 seconds. Then again go for second. Day by day increase it to the 10. These 2 are sufficient exercises. Third, you can ask the patient to lie on back, whatever. That is also one can do. Back, sir. Ask the patient to stretch. हात वर करायचे पूर्ण वर. Stretch hands up and legs down. हात वर टाळायचे, पाय खाली टाळायचे. Stretch it up and legs down. That gives a strength to the musculature, paralumbar. हात वर टाळायचे, पाय खाली टाळायचे. That is another exercise which is helpful. Some people stress more than that, but these are sufficient. आपल्या लक्षात तेवढेच राहू शकतात बस. This is sufficient. Okay. So spinal extension exercises. All spinal canal disorders except one disorder, you must tell the patient spinal extension exercise. काय सांगितलं मी? Except one. Which one? That we will going to learn and then I will tell you. Otherwise, all spinal canal disorders, extension exercises are needed. Right, Lakshat? Lumbar spondylosis. What is spondylosis? Word में मगाशी सांगितलं. Degeneration. It is the degeneration of spine. Degenerative disorder. Common modern era disease. Most common because people are doing a sedentary work, sitting on chair continuously and doing the work. That is first reason. Second reason is that there are people who are opposite to them. They are doing very heavy work by bending forward. शेतात जे खुरपणी असते, शेतात पुढे वाकून काही उचलणं असतं, लिफ्टिंग काही. All those are very heavy work they used to do. They used to produce a severe degeneration. The formation of osteophytes presses on the nerve root and cord, causing occasional spinal canal stenosis. It is the reason where stenosis is more marked. So spinal cord is like that. This should be free, but it gets stenosed because of osteophytes which are pressing on the spinal cord, and spinal cord becomes completely blocked. It's called a spinal canal stenosis. Lumbar or lumbosacral backache with or without lower radiculopathy is the sign and symptoms. Patient comes, doctor, why? He might comes with radiculopathy also. If it presses the nerve roots, he is having the pain along the sciatic nerve also in lumbar spondylosis. If stenosis develops, claudications in lower extremity. Claudications means there are heaviness, cramps which develops after walking for this much distance. Patient has to sit over there. Again he can walk certain distance. Again he has to sit. He cannot walk within suddenly at a time. That is what is called as a claudication. Spinal canal stenosis is second reason other than diabetes developing the claudication. If you check, if you ask the patient to go for a walk and come, if you check the reflexes with the help of your hammer, this is called as a hammer. Hammer is if you check the reflexes, ankle jerk, knee jerk, they are lost. They are completely lost. Whenever patient is having spinal canal stenosis, after walking the knee jerks, the ankle jerks, they are completely vanished. That is again indication patient is having the spinal canal stenosis. Is it okay? Diagnosis, clinical examination, X-ray lumbosacral spine laterals. कसा करायचा? Give the patient purgatives, laxatives earlier day, and next day after passing stools and without taking anything by mouth, patient go for X-rays and then that X-ray. X-ray many times it is sufficient to diagnose. There is no need always to go for CT MRI in lumbar spondylosis. If there is no severe radiculopathy, simple X-ray, lumbosacral spine, epilateral is sufficient. There is no need to go for MRI. But if degeneration is severe and patient is having the problem, tell the patient to go for MRI. Treatment. What treatment you will advise? Auxiliary one side, medicinal on another side. Auxiliary, always keep it in your mind. Auxiliary treatment is very, very, very useful. Otherwise, you cannot treat that patient completely. If patient is having very severe backache, very severe, it is because of lumbar spondylosis. You are damn sure he is having lumbar spondylosis. His age is 65 and patient comes to you and pain is not yet settled. Better is to give him lumbosacral belt, or which is also called as a corset. Corset means which is having a hard rod on back side is corset. That if you apply, what is the use of it? When you apply that lumbosacral corset or belt, the part of the weight is transmitted to that rod, and because of which the weight which is going through the vertebra now gets transmitted through that cord, and patient feels better because there is no pressure on vertebra when you apply the weight. That is the reason why the lumbosacral belt or lumbosacral corset is used. It is only for supportive, but you should not ask it for the youngsters. It should be used only for old people. It should not be used for youngsters. Why? If you apply lumbar belt continuously, the muscles gets wasted. Upon plaster, if you apply the plaster for 3 weeks and remove the plaster, what happens? Those muscles becomes thin because of not use. Same thing happens because of it, and that's why it should not be used in youngsters for that. It should be only used in old ones, this supportive measure. Okay. Second measure which is mentioned in auxiliary when pain stops, gradual spinal extension exercises to prevent the recurrence, which we have learned. Medicine, symptomatic first. If patient is in acute agony, you have to find it out symptomatic. Symptomatic म्हणजे काय, that we will going to learn. What is constitutional, that also we will going to learn. What is biochemic and role of calcareous fluid, that also we will going to learn. And third thing, last thing which is mentioned on that side, you will say, doctor, this is the allopathic. B1, B6, B12 vitamin. What is the role of B1, B6, B12? Those always stimulate the nerves. They are very good nerve stimulators. And that's why giving B1, B6, B12 vitamin is not allopathic. It is a supplement. Supplement is not allopathic. Vitamin is not allopathic. Vitamin is a part and parcel of your daily food. And when you supply it, it is not allopathy. So, in order to support your treatment, if you give vitamins to the patient, is not at all allopathy. Keep it in your mind. Here, whenever the neuropathy is there, B1, B6, B12 vitamin is always supports to stimulate or get the strength, and that's why that can be provided. This is part and parcel of homeopathic management. So, if this is clear in your mind, line of treatment thinking is very clear. one constitutional remedy followed by acute remedy followed by biochemic remedy. If needed, B1, B6, B12, B10. Okay, on auxiliaries line, spinal extension exercises, if needed, belt, corset. You think logically, then you can manage. This is the case, I am going to manage completely. One must be very clear with the concepts. This is what is called as lumbosacral corset or belt. This big thing in between has a rod over there, and because of which, if you ask the patient to bend, he cannot bend when belt is there. And that prevents, specifically in prolapse intervertebral diseases, where patient should not bend, the belt helps. We forget की आपण सांगितलं की पुढे वाकू नको. But whenever you are doing the work, you forget and you bend forward and aggravate the complaint. So, to stop that, better solution is to apply the. Okay. Is it clear? Corset is little bit different. I will show you if it is there. But that has many rods from side. This is corset. Symptomatic means what? Allopathic. What is symptomatic? Like allopathy? No. That is presenting characteristics only. So whatever may be the patient's presenting characteristic, on the basis of that, you must find it out. You must. So first case we have discussed, we came to the Rustox. Why? Because symptoms were presenting of Rustox. Now if a patient is there who is having very severe sciatica, doctor, panic that goes from that side and whole left lower extremity, and it is so agonizing, and I am having very severe pain, I cannot move, and I get frustrated. Patient comes to you with acute agony. What you will to give? Aconite. Why? Patient doesn't have a doctor, I is not like that. That is aconite. If patient comes in that state, yes, aconite. He is predicting the death. Now this patient is like this. Which is the remedy? Causticum is defecting chronic constitution. Acute remedy, presenting characteristic only. Upon Madhya Medica वाचत नाही. We never read the Madhya Medica. If you read the Madhya Medica, you are going to get the remedy. It's so simple. Now get उत्तर लागेल हे पासून जेड. It is simple colocynth. It is simple acute remedy colocynth. Colocynth has a very severe left-sided sciatica, agonizing pain. Pain goes from left hip to the left leg, very severe, cannot move. It is a very important remedy, colocynth, left-sided sciatica. Acute symptomatic remedy. So here you have to find it out a remedy which is symptomatic, which is acute, which might be organ remedy, or sometimes remedy depends upon their pathological sites. Patient comes to you, doctor. पाय जड पडलेत ना, there is severe heaviness. I cannot walk. Patient ने काय सांग? What patient has told? कंबर दुखते, त्या कंबरेबरोबर पाय दुखते, असे जड पडलेत, heaviness, complete heaviness, cannot move. जड पडलेत, numb झालेत, बधीर झालेत. Another word which I have used. आपल्यासारखेच बधीर झाले. What is the remedy? Simple. This is our remedy now. Here you must give gnaphyllum. Gnaphyllum. Gnaphyllum is the remedy which covers, which has having lumbar backache with sciatica, with numbness and heaviness in lower extremity is gnaphyllum. You can give the gnaphyllum and patient settles. This is very important. So, organ remedies. Is it clear? Now we'll discuss some remedy. Symptomatic means you must know where every remedy acts. Rustox acts on fibrous tissue. Rustox action कुठे आहे? Fibrous tissue. मग fibrous tissue कुठे असते? Where is the fibrous tissue? Spinal cord मध्ये fibrous tissue. We have learned the anatomy now. Annulus fibrosus. Okay. All ligaments which are covered with, they are not just a ligament, that is also carrying a fibrous tissue. Bryonia. Bryonia is having action on serous tissue. Serous म्हणजे काय? Which secretes the serum. Serous tissue, which secretes a fluid. So, whenever there is any effusion in the joint, bryonia plays a very important role. So, patient comes with a stitching pain and knee is like this, big, and there is a effusion. In simple word, patient's language, doctor गुडघ्यात पाणी झालं. आपल्या डोक्यात झालं, पेशंटच्या गुडघ्यात झालं. Then bryonia always helps because bryonia has action on serous tissue like APs. Ruta has a periosteal action. Periosteum means outer coverage of the bones. Cartilages. Where are the cartilages? Cartilages कुठे असतात बॉडी मध्ये? Ribs, yes, intercostal rheumatism. Cartilages are there between the ribs. Then ribs get joined with the sternum. In between is the cartilage. Costochondral junction. Chondra means cartilage. Ear pinna, cartilages. Knee joint, meniscus in between is cartilage. So wherever the problem or pathology lies in cartilages, we must think, अरे पेशंटला रुटा द्यायला पाहिजे. We must think logically. We must think with scientific aspect of it. Our aspect should develop completely. Then we are sir, रुटा का देतात कळलं पाहिजे. रुटा का देतात तिथे cartilage. Ruta is having very specific action on cartilage. And again, you should not go it with low. This is a bad habits of you homeopaths. They start with 30, 200, 1 mm. And then when they reaches to 10 mm, then they get the result. Homeopathy is slow in action. So, if you know the patient is agony, his susceptibility is high. What is your thing? What you have to do? You have to go for high potency. Patient will be settled next day. Then patient understands homeopathy is very acute in it. You must understand the potency. Then you can catch that. Bellis perennis, this is the remedy. Muscle fibers, this is very important. There is one word written in Bellis perennis called as releve spine. आहे का असा शब्द बघा इटालिक्स मध्ये दिला बेलिस पेरेनिस मध्ये releve spine. What is releve spine? It is a bamboo spine. Bamboo spine is an indication of ankylosing spondylitis, where there is complete curvature is lost and whole spinal cord looks like a bamboo. There is no curvature, kyphosis, scoliosis, kyphosis or lordosis, absolutely lost over there. It is complete straight lumbar spine is there in ankylosing spondylitis, is a releve spine, Bellis perennis. We must think logically and correlate the clinical disorders with the materia medica, then we reach to the right remedy. Then we get very clear-cut ideas of it. So when we are reading materia medica, how do we read the materia medica? We start with sentence 1 and we end with sentence end and nothing is grasped is called as a materia medica study. We do such type of study. Otherwise, second very important method is there with BHMS students. They never read it directly, write it in exams. Is another. They write their own stories. That is another method in homeopathy. They write their own remedies. There are many publications available. So every remedy is having their own importance. Bellis is having muscle fiber actions, chronic muscular problems, brain strains. Bellis also plays a very vital role. Arnica. Wherever there is a long continued injury is there, arnica plays very vital role. डॉक्टर 10 वर्षापूर्वी मी पडले होते तेव्हा जे लागलं तेव्हापासून अजून दुखतच आहे. Arnica is the remedy. It is chronic injuries. If you open the Allen skin, it has been written chronic years injury happened years back. Written over there. It is having action on muscular tissues. It is having tendinous tissue. So tendons, whenever the injury is there and it is blood trauma with the bleeding, with the hemorrhage, arnica is having very important future, which we never take into consideration. There is a one characteristic symptom. How are the stools of arnica? They are ribbon-like stools. Ribbon-like stools. म्हणजे काय? Patient तो डॉक्टर मला ribbon सारखी संडास लावते. There I have seen 3 patients who told me, Doctor, chapti sandas. They talk like this. And why this happens? This happens because the prostate, posterior enlargement of prostate pressing on the rectum, producing a ribbon-like stools. And arnica is the remedy. We never think of prostate arnica काय संबंध आहे. We never think because we know arnica only for injury. We must read it and understand it. Why the ribbon-like stools? There are significance. We must know all those things. Simicifuga. Simicifuga is very important remedy. Specifically, whenever the trapezial myofasciitis is there, patient is not able, long muscles getting involved, patient is not being able to typewrite or piano players or all them, and the muscles. First remedy is Rushtox. If Rushtox fails, think of simicifuga. It is very important. Whenever patient complains trapezial myofasciitis, first remedy to be think of is Rushtox. Second remedy is the simicifuga. Very important. Bellies of large muscles gets involved. So these are few I have given examples. There are many more. This is the way one should think. That's what I have given the example. Is it clear? Now I have number 10. Role of biochemics and biocombination. I have explained over there. Few students who knows this, many of you don't know it. And those who know it, they forgot. That is another thing. Forgetfulness is common symptom of patient. Study of those remedies on the basis of pathogenesis, and when we apply, we can utilize them properly. I am using in my practice since last 35 years the biochemics, and they gives wonderful results in practice. This is the genus, or this is the cream which I have explained. This is what, if you understand, if we learn the pathology properly, we can understand this on the basis of pathological presentation. That serum phosphoricum, the first stage of inflammation where congestion is there. The prior to the belladonna is pheromone. Prior to belladonna. Belladonnaच्या आधीची stage. Just prior to the belladonna is always a. And before belladonna there is one more remedy. Which is that remedy? Before belladonna. Which is the remedy? एवढ्या वेळ शिकवलं काय व्हाय? It is the first stage of inflammation before localization takes place. असं त्याचं sentence आहे एकोनाइट मध्ये. Before that, localization takes place. Before localization means patient complains only of a pain, agonizing pain, without any inflammation. It is only remedy where inflammation is not yet localized. म्हणजे घशाला सूज दिसत नाही आतमध्ये, घशाला सूज दिसत नाही परंतु खूप पेन आहे, दॅट इज अकोनाइट. अकोनाइट नंतरची रेमेडी पेरमपॉस, पेरमपॉसच्या नंतरची रेमेडी नाही म्हणून तुम्ही बेलाडोना, बेलाडोना नंतरची रेमेडी when the inflammation, congestion is there, severe congestion, redness is belladonna. When it starts becoming dull, dusky, with drowsiness, with restlessness, patient looking toxic, is gelsen. That is next day. Then comes Kali. This is biochemic, that's why those I have not added, but then Kali comes. Kalimur is second stage of inflammation where pus started accumulating over there. There is a changing from that direction to the yellowishness is Kalimur. After Kalimur it becomes more yellow is pulsatilla. Is pulsatilla. Then it becomes completely yellow where little bit aperture you can see, or you can see that eruption containing pus is Kalisar, and when it is accumulated with the debris it becomes chocolatey in color little bit, then that is a dark yellow, that is calcareous, and here the protrusion is there but abscess is not yet open. You have to open the abscess, give the silicia. Silicia is the remedy for the fibrosis when it opens and it heals with fibrosis. These are the stages of inflammation. So just looking towards it you can catch, yes, this is the remedy. This is my understanding regarding the remedies on the basis of pathology. This is in their remedy. But what I told you, the in between stages, that is my understanding about the remedies. So aconite followed by belladonna, followed by perampos, followed by gelsemium. Gelsemium is followed by Kali muraticum, pulsatilla, Kalisal. In between is pulsatilla, then Kalisal, calcareous, after calcareous. Okay. Coloration, that's why I use that specific color over there. This is regarding the inflammation. Is it okay? We'll go ahead. Calcarea pure, fifth stage degeneration. Here the degeneration of the tissue, osteophyte formation, degeneration with varicose veins, varicosities, calcarea pure, tumor formation, calcarea pure, heart tumors, calcarea pure, exhaustosis, calcarea pure, ganglion, calcarea pure. You have in many degenerative changes in the calcarea pure. That is a wonderful remedy in our Mathemedica which brings back again into the normal. McQuas, a very important remedy for all types of spasms, pains, neuralgia, neuralgic pains. So this is a wonderful remedy to tackle the pain. Then calcarea pus, here it plays role with two aspects, degeneration as well as regeneration. Degeneration as well as regeneration. So whenever there is an osteophyte formation, that osteophyte set gets degenerated, removed with the help of calcarea pure, but the bone should come again in its place. Calcarea pus helps to make it straight. So along with calcarea pure, you must give the calcarea pus so that there will be a helpful. It will be helpful to getting again remodeling the structure. This is how I used to use. This is my logic. I am giving it freely. This is not given in any book, not at all. But this helps a lot to recover all those problems of spinal canal stenosis, all those problems of osteophyte formation, all those problems of osteoarthritis of the knees. This helps a lot. This is too important. Natrum sulf, psychotic inflammatory condition. It is green because all discharges in natrum sulf are green. Second important thing, it is a completely psychotic means it is a miasmatic psychotic remedy. So whenever rheumatism is of a psychotic inflammation, there is a gonococcal arthritis, natrum sulph is the remedy. Whenever it is rheumatoid arthritis, natrum sulph is the remedy. Because rheumatoid arthritis is psychotic. If it is ankylosing spondylitis in early phases, maybe a natrum sulph because it is psychotic. So any disorder psychotic over there can be a natrum sulph. Then comes the Kali phosphoricum. Kali phosphoricum is a very good homeopathic tranquilizer. At the same time, it relieves the nerve pains, neuralgia. So if a patient, then if now you have understood, this is the cream which I have told you regarding the remedy. Now if the patient comes with a severe osteoarthritis with a pain over there, so which remedies out of this should come in your prescription? Which remedy should come in your mind out of these? This is the logic which I used to use. Do you know there are 28 worldwide biocombinations? माहिती? नाव माहिती आपल्याला 12 रेमेडीजचेच माहिती नाही 28 चे कुठे कुठल्या 12 टिश्यू रेमेडीज? You must tell which are 12 remedies first. Huh? Which are 12 tissue remedies? Then we'll talk about combination. Anyone without mistake, who will going to tell? What happens? We keep our intellect aside, or either there is no intellect. Just now you are written over there. There are 3 calcareas. Calcarea pure pos cell. Then there comes parapos, single. Then again 3 kalis. Kali pure, kali pos, kali cell. Then again single mac pos. Then again phi natrum, natrum pure pos cell. Again single silicium. Okay. 12 tissue remedies. 12 tissue remedies. ज्या सुसलरने शोधले ते कशावर शोधले? तो म्हटलं एवढ्या 1000 रेमेडीचा अभ्यास करण्यापेक्षा 12 टिश्यू सॉर्ट सोपे आहेत ना. आणि ते फिजियोलॉजिकल आहे ज्याच्याने बॉडी कॉन्स्टिट्यूशन बनतो. त्याच्यात मॉलिक्युल्स गेटिंग which are deficient produces a pathology. You have to fulfill it at molecular level and it recovers the patient. That was his thought, simple. 12 tissue remedy. And he was very particular, he was very good physiologist. He was knowing every remedy in its function inside the body. He was knowing the function. And that's because of that it was quite possible for him to come to the very right remedy. If you read only 2 pages of every remedy from start to general biologico-chemical action, एवढाच पार्ट वाचायचं, that only you read from the Sushlas Mat remedy. 12 remedies, 24 pages. That's all. You start practice by it. But if you understand the depth of it, there are 28 combinations of these 12 remedies, which are called as biocombinations. कोणाला सांगता येतं? बघा मी ना फक्त सांगतो. If you don't know, it's really good. Why? Otherwise you make, yes, first is anemia, should be used for anemia. It's not like that. First is anemia, second asthma, 3 coli, 4 constipation, 5 coryza, 6 cough, 7 diabetes, 8 diarrhea, 9 dysentery, 10 enlarged tonsils, 11 fever, 12 headache, 13 leukorrhea, 14 measles, 15 menstrual complaints, 16 nervous exhaustion, mental exhaustion, 17 piles, 18 pyorrhea, 19 rheumatism, 20 skin complaint, 21 teething troubles, 22 scrofula, 23 toothache, 24 mental exhaustion, 25 indigestion, 26 easy perturbation, 27 lack of vitality, and 28 general tonic. I have taken the seminar at Sangli, and when I said this 28, the people, they have clapped a lot. My wife, she was sitting over there, she also clapped and she said, very nice, I got the Nobel. So, we must know all those things. Names are very important, no doubt. You can use at least for 28 conditions you can use if you don't have any intelligence. पेशंट काय याच्यापैकी काय असेल सांगा मी ट्रीट करतो यू इट्स ओके बट इफ व्हॉट ईच कॉम्बिनेशन कंटेन्स इज व्हेरी इम्पॉर्टंट बट यू मस्ट नो व्हॉट ईच कॉम्बिनेशन कंटेन्स अँड हाऊ इट ऍक्ट्स दिस इज द लॉजिक विच आय यूज टू यूज इन माय नाउ यू कैन सी 23 नाव काय टूथेक बट व्हॉट इट कंटेन्स इट कंटेन्स पेरम्पॉस. It contains Calcarea pure. It contains MAC-POS. 3 important ingredients. Perum-POS, first stage of inflammation. Okay. Calcarea pure, degenerations, osteopathic formations. MAC-POS, spasms, pains, neuralgias. आता फक्त टूथेक मध्येच असं होतं का? Patient comes with knee pains. Useful in any degenerative inflammatory condition which is painful, you can use 23. There is no need that it should be used only for toothache. I used to use toothache. There are 3 combinations which contains Calcarea pure. One is 23, second is 26, and third is 17. पहिल्याचं नाव toothache, दुसऱ्याचं नाव EG perturbation, and third is pilus. I used to use more 26 because it contains Calcarea pure and Calcarea pos. It contains both, and that's why in my practice I used to ask every time 26. Many times I used to order 100 bottles, 100 dabba, 500 grams. One company, they called me, do you have so much of delivery cases in your hospital? You ask every time 100 teams of 20. So I never use it for easy perturbation. I used to use it for this condition. This is piles. Piles contains Calcarea pure, Perum-POS, Kali-POS, Kali-POS. Calcarea pure for degeneration, Perum-POS for first stage of inflammation, Kali-POS for second stage of inflammation, and Kali-POS for tranquilizer. आता एखादा पेशंट आला डॉक्टर झोपच येत नाही इतकं बेजार झालं ही इज फ्रस्ट्रेटेड इतके गुडघे दुखतात बेजार झालो इतकी कंबर दुखते फार बेजार झालो रात्रीची झोप लागत नाही इज फ्रस्ट्रेटेड देन यू नीड अलॉंग विथ द 23 Kali-POS should be there. Kali-POS will give him good sleep. Allopaths and Alprex देतात आपण Kali-POS देतो यूज द लॉजिक ॲलोपॅथ कडनं काही लॉजिक शिकायचं पेशंट रात्री झोपेत उठवत नाही Kali-POS दिलं तर they used to give the Alprex, we used to give the Kali-POS. Degenerative, inflammatory, frustrating condition. 17 plays very vital role. Correct? I am not using it on names, files. Okay. And third, this is most common. I used to use 26. Calcarea pure, Calcarea pos, MAC-POS, Kali-POS. Useful in any degenerative musculoskeletal. Musculoskeletal because Calcarea pos works on muscles and fluid works on joints. Musculoskeletal, inflammatory, degenerative, frustrating condition. So Calcarea pure degeneration, regeneration plus degeneration, Calcarea pos, MAC-POS, neuralgias, pains, spasm. Kali-POS tranquilizer as well as neuralgia. Patient will be going to get settled with 26 very fast. This is how I used to use the bio combinations. Only 3 I have given the example. Now we'll turn towards that case. आठवती case? Guy. Patient was there with a very severe pain over there. Now see. His MRI 14,798 the MRI widespread degenerative disc disease with marked narrowing of L3-4 disc, large diffuse disc bulge at L4-5 causing marked thicker sac compression and severe focal stenosis, minor degree of disc bulges at L3-4, L5-S1, bilateral root compression at L3-4. So L2 पासून ते L5 पर्यंत, L3 पासून L5 पर्यंत everywhere the spinal cord is getting compressed. Diagnosis is spinal canal stenosis. Is it acute or chronic? Chronic. So what will be your treatment? Has consulted number of orthopedicians within 2 days. Everyone asked him to go for surgical intervention. Someone asked him regarding homeopathic treatment at our center, and that's why he directly came from Bharati Vidyapith to Sangamner. So patient was admitted in our hospital. खाली माझं छोटंसं हॉस्पिटल आहे, त्या हॉस्पिटलमध्ये त्याला ऍडमिट केलं 18/7/98. सेकंड कंप्लीट बेड रेस्ट, लंबर ट्रॅक्शन. आता लंबर ट्रॅक्शनचा रोल का होता? लंबर ट्रॅक्शन नुसती रेस्ट दिली असते चालली असते, पण पेशंट फील्स काहीच केलं नाही. थिंक यू हॅव टू थिंक द पेशंट सायकोलॉजी. If you admit him and never give anything, he feels why you are keeping me over here. Better is to apply the lumbar. It is not an acute case where lumbar traction plays very vital role. But for the purpose that he will going to take a complete rest, that's why lumbar traction was added. 18/7/98. Brian at 10M TDS with biocombination 17. First prescription was Brian at 10M 3 times because that acute totality was completely of a Brian. त्या पेशंटची acute totality Brian ने दाखवत होती. तो स्पाझम मध्ये होता, त्याला पेन होतं. He was not able to turn in bed. He was not able to walk certain distance. Aggravated by slightest movement. Claudication से एक पेशंटला थोडं चाललं तरी. So he was completely thirst for large quantities at long intervals was there. He was having large hard knotty stools like Bryony. So Bryony was given in 10M potency along with 17. 17 का आता अपन पाहिलं. Then I have given him 17. Follow next day 19/7. Pains decreased due to continuous bed rest and traction, and then I have given him tuberculinum 1M dose as a much. Continued rest of things as it. Tuberculinum, you have explained with phosphorus, but tuberculinum was right because there was past family history of tuberculosis. His constitution was tall, slender, weak, emaciated, narrow-chested, was tuberculinum, and his problem was chronic enough to give him antimiasmatic remedy. So 1M 1 dose of tuberculinum was added, otherwise same continued. On 4th day, 21/7, no pains, asked him to walk some distance with application of lumbar belt. Then I म्हटलं बाबा, you apply the belt and walk for certain distance. Biocombination 17 continued rest of the things as it is, and patient was able to walk a certain distance. Hospital मध्ये त्यांना म्हटलं चक्र मार, and he was able to walk nearly about 10 times without any pain. So asked him that's all sufficient today. Continued with the same. 25th, patient was discharged. No pains. Asked him to walk some distance with application of lumbar belt, and I have discharged him. Continuing with the 17. 17 दोन वेळा चालू ठेव. That's all. सकाळ संध्याकाळ that you have to continue. That's all. And patient was discharged. Asked the patient to meet me after 15th. Patient came on 7th. Able to walk properly in his house without any trouble, no pains at all. 17 continued, and then I have added spinal extension exercise. Spinal extension, everyone knows. Okay, spinal extension exercises. Follow 1 महीने 11/9/98. Absolute no pains. Able to walk 1 to 2 kilometers without any trouble. Continued same management on 1st of March 1999, after 6 months, able to walk as a normal person. Medicine stopped, continued with the exercises, and no more surgery, nothing is required. He made me up when we started the camps over there. He made me in the year 2015. Means after how many years? Nearly about 17 years. And he came for his wife's treatment over there in camp. He was from Homoeopathic and he came over there in Rajuri. He knows, sir, to me camp chalu kela, that's why I came over there. And he came over there. So this is the wonderful result with the homeopathic treatment. So this is the case. This is one more case. This is lumbar spondylosis with spinal canal stenosis. This is a recent one, not old one. And obese, 69.4 kg, 54 years lady, Mrs. SJK, came to me on 7th February 2022. A case of chronic lumbar backache with severe knee pains since last 9 years. Her suffering was so severe that she was weeping due to the pains as well as on treatments. She was quite religious lady who couldn't tolerate any justice with anybody. She had recurrent dreams of water. Her face had brown pigmentation, plasma. She was not able to walk few footsteps. She used to get claudications after walking for very small distance. She was not able to bend her knees. She was not able to bend, not at all. Then a bend this much was. She was not able to bend. So much big knees were there, swollen. And showing the bowing of the lower limb. Bowing म्हणजे काय? तर दोन्ही lower limbs they असे झाले, ते धनुष्यकृती. Because medial meniscus is degenerated, and that's why this is how a position of lower legs comes. That is what is called as the bowing of the. And she was not able to walk. When she came right from Srirampur, she walked very few distance, and after coming out of her vehicle to reach to my clinic, it took 5 minutes for her. So much pain was there. So both knees, when I examined with the knee examination, we'll see now the knee examination. शिकून घ्या knee examination, how to examine the knee. Whenever you have to check the knee, first important thing, always ask the patient to remove the clothes and see the knees first, and check with the back of fingers, how part does go, temperature over the knees. That is the first important thing which you have to do. First you have to observe whether there is a swelling. पहिलं काय पाहायचं? What you are going to see? You will see whether there is any swelling. Second important thing, just check the temperature. If patient complains, doctor माझा डावा गुडघा खूप दुखतो. If patient complains, left knee is painful, just touch and see the difference. If patient says that it should be inflamed, it should be hot enough, which you can confirm, patient खोटं बोलत. With the help of your back of hand, that is more important. Third important thing, now keep your hand on the knee, left hand, and ask the patient to bend the knee completely. This is what you have to do for both the legs. Many times you get the crackling inside. Whenever the degenerative disorders are there, osteophytes are there, or meniscus gets completely degenerate, it crackles. So when you push it, you feel it to your hand, left hand, that there is a crackling. It indicates there is a meniscus there. That is third thing. Fourth thing, you have to keep left hand over the patella, and with the right thumb you press the patella, and if you press and if it moves, goes up, floating inside the joint, it indicates knee joint has an effusion. It floats. Patellar tap is positive. That is what is called as patellar tap is positive. If patellar tap is positive, it indicates that there is an effusion. It indicates that you must think about Bryannia ipis, Apocynon, Kalika, where serious inflammatory remedies are there. I used to use logic like this. I never used to think to a patient, you must think what is the problem. Kalika, serous tissue, Bryonia, serous tissue, ipis, Apocynon, effusion. You may have to think logically. Then you get the results in such types of cases. So patellar tap that you have to check. This is called as a patellar tap test, which you have to see. Then ask the patient to raise the right leg up. Keep it down. Left leg up. Keep it down. Ask the patient to bend the right knee first on the tummy with his both hands. Keep it down. Left one. Then both at a time. Then press both the knees down. If there is severe osteoarthritis, their knees never touches the floor, bed. They remains like this, up. They cannot press it completely. That indicates there is severe type of osteoarthritis which is not coming down. These are things which you have to catch from the patient very easily. Very important. So you ask the patient to that, then ask the patient to squat. झोपून मांडी घालायची. This is again very important. Many patients who are having severe osteoarthritis of the knees cannot make the squat. Not possible. Even hip joint pains or AVN, patients are not able to squat. You can catch what the patient pathology is there so that you can treat accordingly. So these are things and these are the same exercises I used to ask the patient to go for. These are 5 exercises I used to ask every patient to go. Because these are very important for the mobility of the knee, where you are not putting any weight over there. These are called as non-weight bearing exercises. काय म्हणतात त्याला? Non-weight bearing exercises. And when you do non-weight bearing exercises for the patient, it never aggravates the condition. Weight bearing तुम्ही सांगितलं पेशंटला उठ बशा काढ. जो चांगला होता जाऊन तोही दिसून दे. That will going to degenerate because you are doing weight bearing exercise. It is not at all told. You should not tell patient to go for weight bearing exercise. You must tell the patient non-weight bearing exercise. Is it clear in your mind? Yes. So these are the things which you have to check. First important thing, you instead of checking by yourself, you should ask the patient to do all those activities because patient know where pain is. Otherwise you directly start and patient cries, oh doctor, then you can create a problem. So first ask the patient to do all those activities and then you start checking the patient. Is it clear? Okay. Sit down. Now I will tell you one more thing immediately. Patient la exercise आता मी जे 5 सांगितले. Those are 5 exercises which you have to tell. For knee, specifically osteoarthritis of knee, you ask the patient to make the sit like this on the cot or any table and ask him to raise the right leg straight. Without jerk, तो ने पाय सरळ करायचा. मग तिथं थोडा वेळ धरून ठेवायचं. You should lift it for some time. Then gradually keep it down. Then left one up without jerk. Keep it down. Again a non-weight bearing exercise. You are not doing a weight bearing. You are doing non-weight bearing exercise. Non-weight bearing exercises always helps. This is non-weight bearing. You ask this for the patient to do. In lying down position, when you ask to press the knees, why do you ask to press the knees? You ask the patient to press the knees down. Press it hard. Press it, release it. Press it, release it. You are building your quadriceps. And for same purpose, you do that second exercise in sitting position. Here you strengthen your quadriceps. The logic is that when you ask the patient to do this exercise, the quadriceps will become strong. Then part of the weight which is passing through the joint, it passes through the muscle. So the weight over there, a pressure over the joint gets released and patient feels better. Is it clear? Part of the weight is passing through the quadriceps. So you are making strengthening of the quadriceps, and because of which the pressure which is causing degeneration over there, that never happens because of those exercises. What is the purpose behind that exercise, that we must know. If you are doing it, we must know why it is. Okay. So both knees show the crackling while examining with effusion in the joint. Okay, this is the case. All reflexes from both lower limbs are lost after walking for 5 minutes, indicates spinal canal stenosis. मी पेशंटला सांगितलं एवढं बाहेर चक्कर, ती म्हटली मला इथून इतकंच नाही जाता येणार, कुठेच जाता येणार. सो आज जस्ट क्लिनिक मध्ये 2 चक्कर मारून झोपा. And when I checked her, all reflexes were absent, no reflex. Indicates spinal canal stenosis. Pitting edema over the limbs. दोन्ही पायावर pitting edema होतं. Pitting म्हणजे काय? There is a pit. खड्डा पडत होता. There was puffiness of the face. Lower limb ला अशी सूज आलेली होती. Blood pressure was 185 by 130. काय करणार? Now how will you manage this case? Refer to physician and orthopedician. So how I have managed this case? This was MRI. MRI काय सांगतो बघा. Changes of spondylosis, diffuse altered signal intensity area in L1 vertebra body appears neoplastic etiology may be. Diffuse posterior bulges at L2, 3, 3, 4, L5S1 intervertebral disc causing significant indentation of the thecal sac. Diffuse posterior bulge with right paracentral protrusion with inferior migration noted at L4, 5 intervertebral disc causing compression over the thecal sac and right L5 transfer nerve roots. Ligamentum flavum hypertrophy is seen at L4, 5. This is the importance of understanding anatomy. Ligamentum flavum कुठं पाहिलं होतं आपण? स्पायनल कॉर्डच्या पोस्टेरियरली ligamentum flavum असतं. मग आपल्याला MRI वाचता आलं पाहिजे. It is very easy to say do MRI. Understand the MRI, that is more important. So this is spinal canal stenosis. This is the case refertilization sheet. Weeping, cripples about weeping, pains with religious affections, injustice cannot support, dreams water, face cloasma, obesity, humanism. Through and through was sepia. Through and through was sepia. Second is pulsatilla, third is lipo. How I have managed this case? I am not admitted. Management of senile osteoarthritis spondylosis. काय करायचं? Auxiliary line of treatment is reassurance. Means होईल बरं. असं सांगितलं की पेशंट डॉक्टरला ते कर वाटत नाही. You should be confident. तुम्ही काय काळजी करता? मी आहे ना. फक्त मी सांगेल तेवढं पाळलं. पहिलं काय? You must follow what I am going to tell. If you don't follow, there will be no result. What you are going to tell? You are going to tell this patient that her weight is 68, she should come to 52, then she will be better. Otherwise, she will not going to get better. Her obesity is, तुम्ही reporterization ला obesity rubric घेतलाय. Her obesity should be treated, then patient will be settled. Otherwise, patient will not going to get results. So, आता obesity कमी, तोंडावर तापा करावं. This is very important. So you have to tell the patient exactly how to reduce the weight. That is another point. Rest till the pain settles. Otherwise, exercises and warm application. Again, hot fomentation, dry hot fomentation. Medicine, similimum, homeopathic palliation remedies that also already we have discussed. Rustox, Ruta, Bellispur, whatever it may be. Biochemic biocombinations is needed. This is the management. आपल्या डोक्यात हा चार्ट पक्का असला पाहिजे. आता आपल्या या पेशंटला काय दिलं? Her weight was 69.4. Asked her to do simple stretching exercises. Sepia 1M 3 dose stat. I have given Rustox, I have given Ruta, I have given Naxonica, I have given 26. Come. Here Odes appear. Here most important thing, what pathology she is suffering from. She is suffering from not only spinal canal stenosis, she is suffering from the knees, osteoarthritis of knees with big effusion over there. She has both the modalities, she had very severe stiffness in the spine. So, sepia is her remedy. But if you give sepia and will wait for 1 month to act, patient will run away, never comes to you. If you want your patient to be with you, you must produce results within first 15 days, otherwise patient will not. This is the most important thing which you have to do. पेशंटला 15 दिवसात बरं वाटलं तो पेशंट तुमचा, नाही बरं वाटलं तो पेशंट गेला. असं आणि लोक त्याचा अर्थ सांगतात मी पहिल्याच डोसला बरा केला, परत यावंच नाही लागला, तो आला नाही हे नाही सांगत. So first important thing, keep it in your mind that you have to produce very important thing. Ruta is very important remedy whenever cartilages gets degenerated. That's what I have told. Fibrous tissue whenever gets affected and there is a stiffness, Rustox plays very vital role. In 10M potency, it relieves the stiffness. Ruta, it reduces the fusion very fast. Cartilages degeneration, it is a wonderful remedy to stop the pain. Naxomica, because patient has consumed lot of allopathic medicines. Nux plays a very vital role in order to maintain the GI tract. And then 26, already we have discussed why 26. Okay, this is the prescription which I have given. Asked her to meet me after 15 days. It was 17 February, 25th March. Back in much under control, able to walk outside around 1 kilometer, knee effusion decreased, right knee pain while walking, morning stiffness occasional, patient's weight, how much she has reduced within a month? 5 kg, 64.5, following diet properly, blood pressure 166 by 101. It is also reduced. Without any antihypertensive, it is reduced. Because she has followed the diet, doing regular stretching exercises. So what you will do? So I have given this prescription. In between one prescription was there, then sepia 50 3 dose stat, bryonia. I have changed the remedy from Rustox to bryonia because of her modality. And then I have given Ruta, Naxomica and 26 I have read. Sepia only I have really increased from 1M to 10M in between and 10M to 50M. After long follow-up is there, in between follow-ups I have not written. 10th May 2023. No more stiffness, able to do all the activities, doing regular walk, weight 55.4. खरं तर आत्ताचा परवाचा व्हिडिओ तुम्हाला पाहिजे दाखवता आला असता. It was not possible. Just now she met me, doing very regular spinal extension, flexion exercises, met me once in 4 months. Blood pressure 130 by 90. She complained of ingrowing toenails now. त्याचे नखं आत चालले, ingrowing toenails. Ingrowing toenails are there, that is condition surgical. But we have very good remedy. That is from Imponderabilia kingdom. Magnetis polus australis. That is a good remedy for this. I use that for her. If you want to see the video, this follow-up video is there. Video 1 2. पेशंट माझ्याकडे आले की येतानाचा व्हिडिओ, पेशंट चालतानाचा व्हिडिओ, जस्ट चेक बघा. शी इज द पेशंट. नाउ शी वॉक्स ॲब्सोल्युटली नॉर्मल. शी इज व्हेरी हॅपी बिकॉज तिने काशी यात्रा करून आली, 4 धाम करून आली. दॅट इज व्हेरी इम्पॉर्टंट. दिस इज वंडरफुल. आता येऊन गेल फॉलोअपला, जस्ट नाउ लास्ट वीक शी केम. Completely recovered from the whole, not only spinal problem as well as legs. She is able to do SLR. She is able to bend the knees, which was not possible. See, she is able to do this. She is able to press the knees, and she is able to squat. Mandibles. So this thing is possible only with homeopathy. So accordingly, when we manage the things properly, we can get such types of results. Is it okay? So I will not show it again because video will not run over here. This is not okay. Then I have given Magnetis polus australis for her growing toenails and only 26. Rest of the things I have stopped giving her. And she was wonderfully recovered from that. So we have discussed many lumbar canal disorders. Their homeopathic management will, along with importance of diagnosis and investigation. Let us turn towards the lumbosacral. Lumbosacral मध्ये very important is rheumatoid arthritis or ankylosing spondylitis. Ankylosing spondylitis असं म्हटलं जातं, this disorder it should not happen even to your enemy also. It is written in book. It is so worst disorder which affects the whole human life because of it. So rheumatoid arthritis or ankylosing spondylitis is an autoimmune disorder. Our immune system fights with oneself, so it is systemic disorders. Systemic का मतलब why it is called as systemic? It never involves only joints, it involves whole body. It involves the blood, it involves the eyes, it involves the heart, it involves the respiratory system, it involves the GI tract. So it acts at all levels. That's why it is called as systemic disorder. Systemic lupus erythematosus, systemic disorder. Ankylosing spondylitis, systemic disorder. Rheumatoid arthritis, systemic disorder. These are all autoimmune. But we don't know what autoimmune and what is the miasmatic background are behind the autoimmune. So we are going to learn associated with multisystem affection. Generally, what should happen in human life? तुम्हाला एकाने कोणी मारलं, what you will do? You will react त्याला माराल. This is a tactile reaction. This is how you fight. This is not normal human reaction. Those persons who are psychotic, it is not PSY, it is SYCOTI. Psychotic म्हणजे from homeopathic miasmatic background point of view psychotic. Someone comes to me and says, सर तुमच्या विषयी ते असं म्हणत होते, ते सर तुमच्या विषयी असं बोलत होते, तो स्टुडंट तुमच्या विषयी असं म्हणत होता. If I am sorry, what I will do? I will go to that fellow. Have you talked with this? If yes, why? And then I will react. That is natural reaction. Sorry. Psychotic already knows his weakness. What he starts feeling? He starts feeling. He will react to that fellow. Okay. He will not show his emotions. He will not going to show his emotions. But what he will do? His reaction has started. With whom? With the fact. He don't know whether it is fact or not. Someone has created image in his mind. With that image, he started fighting and reacting. Means he is reacting not with others, he is reacting with oneself. He is not reacting with the antigen, he is reacting with the antigen which is there inside your body. Is autoimmune reaction. Miasm? Psychotic. Simple. So there is no antigen antibody reaction. Fight against oneself is psychotic. All autoimmune disorders too are psychotic in origin. Later they become syphilitic. They turn towards regeneration very fast. But to start with, every autoimmune disorder is psychotic in origin. Is it clear? So if complication develops, degeneration develops, indicates the psychosyphilitic miasm. का सांगितलं? नाउ यू हॅव टू ट्रीट द पेशंट ऑफ ankylosing spondylitis. Your remedy should match the myasthenia. Otherwise, if you give Rustox, nothing will work. Because that remedy doesn't carry any strength to reach to that pathology. This is bamboo spine. Clear cut. There is no lordosis, there is no kyphosis. Straight lumbar spine is a bamboo spine. It is ankylosing spondylitis. So patient posture is very important. Patient comes to you. Doctor, there is very severe. Ask him to bend. He bends like this. Ask him to bend back. This is ankylosing. This posture is ankylosing. Very typical ankylosing. You just look toward the patient and you diagnose. This is ankylosing. I have diagnosed many patients. If you know the posture, very easy to diagnose. This is the posture. This is normal. This is ankylosing. Very difficult. Chin bro to the vertical angle, 30 degrees. 30 degrees में पुढे गेलेला. I have treated one patient who was there with my OPD, a Nagar OPD, who was doctor BHMS, 30 years, and he was ankylosed and he is so fibrous. When he lies down, his neck remains like that. 4 उशा ठेवल्यावर त्याची neck टेकायची. So much fibrosis. He was not able to lie down straight. 4 उशा घेऊन झोपला. After span of 2-3 years, his neck came completely down. But this is ankylosis. This is worst disorder to have, ankylosing spondylitis. How will you treat? Auxiliary psychotherapy that you have to give the confidence. Yes, homeopathy will definitely work with ankylosis. Second important, exercises to prevent the deformity. Very important. Mobility is very important. Don't ask the patient to lie down. He will become more stiff. So what I used to ask the patient to go for any ground activity. Ask the patient, you play football, you play badminton, you play cricket, whatever you are able to do that. Because during playing, patient forgets that he is stiff. Automatically he does certain movement and the stiffness gets relieved. That activity I used to tell the patient whenever the ankylosis patient is there. One patient from here, Sangamner, he was there. He was so fibrous, he was not able to do. Asked him to play. He said, "Doctor, I have not played for last 20 years." So asked, now play with your children. He was having children. They used to play cricket. Asked him to play with the children. And when he started playing, he forgot that he had ankylosis because mind also becomes fibrous over there. It is fixed. Psychotic people always have a fixed, rigid mind. They are not able to change. त्यांचे thoughts पण fixed ideas सारखे असतात. They never accepts anything new. But he accepted and he had changed. He started playing with them and he relieved. And he relieved from that within 2-3 years, completely out of it. Medicinal defecting constitutional mathematics minimum is most important remedy will going to work. Acute remedy is not that much important in ankylosis. Constitutional remedy, miasmatic remedy will going to work in such types of cases. Acute, very occasionally, biochemic biocombination always helps. Always helps. So this is the method with which we have to approach. And there is a case of ankylosing spondylitis. This was a young fellow. Whole family is ankylosing. It is hereditary disorder. त्याच्या भावाला पण आहे, त्याच्या आईला पण आहे, त्याच्या मामाला पण आहे. Everyone is having ankylosis. So 24 years young boy, 76.3, was brought to me on 7th May 2020, a case of severe sacral backache. Ankylosisच वैशिष्ट्य असतं sacroiliitis. This is the first joint to get involved, sacroiliitis. So many times it can be mistaken for the prolapse intervertebral disc. Because patient is having pain, he is not able to lift leg. We feel that SLR is positive. It is not SLR is positive. He is not able to lift the leg because of sacroiliitis. So how will you check? Ask the patient to lie down, check the whole spine. There is tremendous tenderness over sacroiliac joint. Patientचं complaint काय असतं? If patient is from the village, ते म्हणतात चौकात दुखतं डॉक्टर. कुठल्या चौकात? चौकात म्हणजे काय? That is the LS spine and sacroiliac joint. हे दोन्हींचा जो चौक असतो, that is the site, that is the place where the patient complains of pains, and that patient pains are always there, and tremendous stiffness is there. Patient is not able to turn like this because sacroiliitis is so marked, and when you see the tenderness and hotness more there on the joint, you differentiate that this is not prolapse intervertebral disc, but this is the sacroiliitis. So you have to differentiate by clinical examination in such types of cases. So sacroiliitis was there with that fellow. Same thing has happened with this fellow. He was having severe sacral backache with left sided sciatica, numbness treated as a case of disc prolapse from the orthopedician. There was tremendous stiffness in sacral region as well as between shoulder and neck, and he was walking with keeping his hand on his back and tilted position. He came to me like this. I have said, you have ankylosis. He said, no sir. They said that तुमची disc MRI केला disc सरकली. So you are having, I have checked, examined and said you do better on investigation. On examining him, his SLR both sides was normal, but he was not able to turn in bed. He said it gets aggravated during dry cold weather and better during the rainy season. काय सांगितलं तरी? ड्राय कोल्ड वेदरला खूप वाढतं आणि रनिंगला हे आपल्यासारखं आहे होमिओपॅथीचं. For allopathy, this doesn't have a sickness. He was intensely sympathetic towards suffering of others. He said that when he thinks about his condition, his complaints get aggravated. He failed his 10th exam, and that grief was persistent in his life last 8 years. So it disturbed him again and again. He used to brood over the things. His face was quite greasy. Family history, mother, brother, maternal uncles, all having ankylosing spondylitis. Asked him to do CBCSR and HLM invasion. Son, yes sir, was 130 mm. Confirmed this is inflammatory arthritis. And third, HLM27 found to be positive. So he was confirmed case of ankylosing when I diagnosed. It was wrongly considered as a PID, prolapse intervertebral, but I have diagnosed, and then I have reported. This was his MRI. MRI मध्ये त्याच्यात दिलेलं L4-5 disc, L3-4 disc. So wrongly considered this might be a reason, but this was not the reason with the patient. Howley approach. This is the reporterization, and through the remedy was corticosteroid. Stiffness, sacral stiffness, draft of air aggravates pain, turning bed in pain, sciatica, sciatic nerve left. Then there is a sympathetic, compassionate, suffering others to thinking complaints, aggravate mental and emotional sequences, grip elements from mental and emotional consequences, brooding and face greasy. Through and through there was a causticum. So remedy was very confirmed that he is a causticum. Homeopathic management, 28 November 2020, weight reduction I have asked 76.3 होतं. And asked him to take complete rest for 15 days because inflammatory arthritis होता. त्याचा inflammation पहिलं कमी होणं गरजेचं होतं. He was in a bad position. I have given causticum along with Nux-Vomica, Rustox and biocombination 26. Causticum 1 m 3 dose weekly लिहिलंय तिथं. Weekly का? If we read the Borix Materia Medica, causticum in the dose he has written what he has written. See, 12 to 30 is common in chronic elements, especially paralytic rheumatic states. The higher potency is once or twice a week. This is written by Borix. This is very important. If you repeat causticum weekly, specifically in neurological conditions or like these conditions, it helps a lot. Follow 3rd March 2021. Stiffness joints much better. Left sciatica nearly absent. Morning stiffness occasional. Weight 72.7. Followed diet properly. Doing regular spinal extension and flexor exercises. Patient who was not able to do this, able to do all his activities. Forward bending, backward bending, everything. So continued with the similar line of treatment. Causticum 1 m 10 m dealer, and he has reduced all exercises. He was better. Then he was being he is a farmer. He was doing all 100% devotion to his work. ESR करून घेतला. It was 29. 130 to 29. What it indicates? Your patient is cured. Now you can see his movements. Are you bored? Yes? Don't worry, not so much of time, but just see this. This is a wonderful case. See his movements. He is able to do all his activities. Very simple. Now also he is coming for treatment whenever any problem is there, but he is doing all activities. You can see in standing position. See, the spine started bending completely. He was able to do. He is able to bend backwards also now. This is possible, which was not possible for him. Then in standing position, see that he can ask him to bend forward. This is now. And also backward. This is what possible with homeopathy. So, this is the case of ankylosing spondylitis. Now we will go ahead. So, congenital or anatomical spinal disorders. Is there any role? Simple cases. First diagnosis: congenital spinal disorder, cervical rib. Have you heard about it? There is no rib in cervical rib. Yes? If extra rib happens to be there, it is called as extra rib or cervical rib. Signs and symptoms: pain, neck, from the neck radiating to upper extremity. Vascular problems are there. Neurological are less, vascular are more. Vascular means what? Patient complains that there are hot flushes. Patient complains there are sometimes coldness all of a sudden. Patient complains very occasionally numbness. But hot feeling, cold feeling, such feelings are vascular complaints. Because vessels gets obstructed, pressed under that rib. So it is called as neck outlet syndrome or cervical outlet syndrome. Spasms, coldness, sweating, heaviness. This is cervical rib and compression of brachial plexus by the cervical rib. There is one more condition, abnormal scalene muscle insertion, that causes compression of the cervicobrachial region over there. This is the test which is diagnostic. Yeah. This is called an Addison test. If you know the Addison test, you can diagnose this. What you have to do, if you consider patient is having the cervical rib, if your thought is there, always do the Addison test. It's so simple. Just take the patient's right hand in your hand and feel the radial pulse. You should be on the back of it. Then you lift it like this and ask the patient to turn on this right side and look at that corner. And ask the patient to take the deep breath. Your hand should be there on radial pulse. And ask the patient to take the breath and wait for a few seconds. If his pulse gets obliterated, stopped, it means patient is having the scalene sciatica syndrome or cervical rib. This is called an Addison test. Addison test is clinically diagnosed that patient might have a cervical rib. Ask him to go for the rest of the investigations, X-ray, etc. This is the Addison test, how it should be done. So, what are the Investigation: cervical spine, epilateral, upper part of thorax, epilateral X-ray. X-ray is sufficient, no need to go for MRI, CT. This is how X-ray looks like. You can see at the HR clear there you can see the extra rib over there, cervical rib. Another picture is there. This is cervical rib, upper side. But if this is not so clear, you cannot catch. But there is cervical rib, extra rib over there. So cervical rib management, if not so severe, then you can manage that case with the homeopathy. Proper constitutional similum, acute symptomatic and biochemic, this is the management. If severe, causing neurovascular pressing, leading to complication, ask the patient to go for surgical treatment. Then surgical surgery is needed. So both things you have to catch, whether it is severe or whether it is not severe. Okay. Second congenital is spina bifida with myelomeningocele. Surgical drugs are mentioned in our homeopathy, but I don't have any experience or I have not used for myelomeningocele. This is third important. Kyphoscoliosis. It is lateral and forward bending of the spine, either congenital or secondary to any disease. Kyphoscoliosis. What do you feel? Is it curable with homeopathy? Kyphoscoliosis, medical treatment in early age, if we treat with proper simillimum, you can treat completely. During growth period and recovery is possible. I will share one case which I have treated. She was 13 years having kyphoscoliosis. After growth period, surgery is needed. Growth period hoon gela, after 16-18, you cannot make the changes. Congenital spondylosis, lysis and spondylolisthesis. High disease I have explained to you, this is one disease where you should not ask extension exercises, is spondylolysis and spondylolisthesis. What is lysis? This is complaint patient की complaint का asking patient is having chronic lumbar or lumbosacral backache. This is called as pars defect. हा वरचा वाटे vertebra त्या ठिकाणी pedicle ला joint नाही झालेला, you can find it. This is lysis. In between there is a gap. Is called as lysis. In between. So lateral X-ray of lumbar spine shows pars defect. That is called as pars defect. It is not joined with each other. This is called as pars defect. And this is lysis. And because of which one vertebra glides with another vertebra. One goes forward, one goes backward. This is called as listhesis. याला काय म्हणतात? The next slide. So listhesis it depends upon severity. Chronic may not be associated with lower radiculopathy. To judge the severity, ask the patient to walk on toes only and heel only and check the jerks. They are lost. It indicates patient might have a listhesis. So diagnosis: X-ray, left spine, epilateral infection and extension. Very important. Patient चे X-ray कसे काढायचे? फॉरवर्ड बेंडिंग करून एक्स-रे काढायचा किंवा बॅकवर्ड बेंडिंग करून एक्स-रे काढायचा. दोन्ही याच्यात तुम्हाला पास्ट डिफेक्ट दिसतो आणि लिस्थेसिस झालंय का नाही दिसतो. अगेन सेम थिंग, पेशंटला इनिमा द्यायचा किंवा पर्गेटिव्ह द्यायचे. देन यू हॅव टू आस्क द पेशंट टू टेक गॅसिक. आफ्टर पासिंग द स्टूल्स यू हॅव टू डू दोस इन्व्हेस्टिगेशन इन फ्लेक्शन पोस्चर अँड इन एक्सटेंशन, बोथ MRI and CT to judge the severity. This is listhesis. See the spinal cord getting bent. One vertebra is going posteriorly, one vertebra is going anteriorly. This is listhesis. Yeah, if you ask the patient to do the extension, the problem gets more aggravated. याच्यात एक्सटेन्शन एक्सरसाइज सांगितलं, पाठीमागं वळायचं की अजून तो वर्टेब्रा पुढे जातो, वरचा मागं ओढला जातो. And this is the only condition where flexion exercises are needed. Auxiliary exercise, flexion, no extension exercise. Medical, symptomatic, constitutional, mathematic, biochemics, biocombination. Yes, that was. This is the case of a girl, 13 years, chronic thoracolumbar backache since 2 years, aggravated by cold weather. Ameliorated summer and warm application. Allopathic medicines never relieved her complaints, so she came to me. associated with chronic headache on coronary sutures. कुठं दुखायचं तिचं हे असं coronary sutures जे आहेत त्याच्यावर दुखायचं. That was her complaint. Craving for smoked meat. काय आवडायचं? तंदूर. She was craving for that. Tall, slender, big, emaciated, dark complexion, anemic. Remedy? These are the features which are indicated. Clinically appeared as a case of postural backache. असं वाटायचं she is having postural backache. I asked her to go for TL spine X-ray, FAN lateral, and diagnosed as a case of thoracolumbar scoliosis. She found to be a scoliosis, but in the early age, I asked her to start with treatment. Patient had taken different orthopedician opinions. Everyone has suggested symptomatic treatment with physiotherapy and surgical correction in future. So they came to me. Is there any role of homeopathy in such congenital disorder? Let us discuss with the different congenital spinal canal disorders and term with it. I asked her to go for single bar exercise. Single bar exercise म्हणजे काय? वरती अडकवायचं and go for single bar. That helps a lot in kyphoscoliosis cases. Very important. Which is the remedy? Correct, very correct. Remedy was calcaria for 6-6 repeated for 1 month, asked to follow up after 1 month. Backache reduced 50%, weight 32, auxiliary strength, tuberculinum 1M1 dose followed by calcaria for 6-6. No backache, weight 40, X-ray repeated, normal, exercise continued, and she was wonderfully covered. Now we'll turn towards cervical disorders. Already everything is taught, just which are disorders. Cervical muscle sprain, मान अवटळली. This is the complaint with which patient comes. Doctor मान अवघडली, मान अवटळली. रात्री खूप जाडूशी घेतली, मान अवटळली. These are the things with which patient come. Common stiffness of neck muscles, pain. What is the remedy? Hot fomentation, dry fomentation. Avoid taking big pillow. Generally, acute remedy selected on it. Rust of first, second is semicituba, then third ruta, fourth radium brome that you can think about. Radium brome is also having very specific action on it. So these are common remedies which you can think about it. Okay. Trapezial myofasciitis. This is most common disorder, mostly in females. Females मध्ये का? There is a this muscle, trapezial muscle, patangakruti's nahi asto. This looks like kite, and this muscle doesn't have a tremendous function. It has only a support function. It doesn't carry too much of function. Trapezius. That's why their upper layer, myofascia, fascia over the trapezial muscle, gets inflamed. Specifically, more commonly in females. So most common in females than males. Men and stiffness around neck and shoulder blade. You have to examine the cervical spine. Cervical spine कसं check करायचं नीट समजून घ्या. This is very important how to check cervical spine. Just keep your left hand on head. Fix the head. Then your right hand. Start with C1, C2, C3, C4. Every vertebra pressing it, whether to locate whether any tenderness is there. Then you just start with trapezius origin. It is the where trapezius originates? Just below the mastoid. So start pressing it whether patient is having pain and fix it over here and see. If trapezial myofasciitis is there, patient complains, oh doctor, there is pain, trapezial pain. Then you press over the whole trapezius. If trapezial myofasciitis is there, patient complains of pain over there on the trapezius. Tenderness is always there. Then you ask the patient to turn on both sides, turn towards the left, turn towards the right, then ask the patient to turn up, then turn down. See the movements, how much movements are there. Ask the patient to tilt his head to the right, then to the left. These are the things which you have to do. Second important thing, keep your hand on left shoulder. Take his right hand up, external and internal rotation. This is the movement. This is how you have to do. This is one thing. Second, now keep your hand on right side, left up. This. If there is a pain, any pain, you can find it out very easily. Patient might have a cervical trapezial pain. Now, sit down. Second important thing, lumbar, I forgot to tell you, you have to see the strength in legs. पायातली ताकद आणि तशीच सर्वायकल पॅथॉलॉजी कन्सिडर करण्याकरता हातातली ताकद. You have to find it out strength. So ask the patient, you stand like this, ask the patient to press it firmly with themselves. Good. Ask and check the strength. Good. Second thing, then ask him to extend. Then ask him to make the fist tight, and from this aspect check the flexors. And from extensor side, strength. Then you have to ask the patient to press both the first finger and the second on pressing on each other tightly. Just ask this and just try to separate it. If there is a weakness, you can easily catch. Then ask the patient to extend both completely and just check the strength. This. You can find it out the strength in the muscles. Accordingly, where is the weakness? If you are able to catch the weakness, that cervical nerve is at the problem. You can catch on the basis of that. This is clinical examination which gives you a confidence. Yes, this is the diagnosis. This is my clinical diagnosis. Then you check it on MRI. Same is you have to do for checking the strength in lower extremities. Lower extremity मध्ये strength check करायची. Ask the patient to lift the leg and press it. See the strength. Same extensor you are checking. Now ask the patient to bend and then ask him to extend. This is how you have to check. Ask. This is the way. Second thing, ask him to lift the foot up. Leg extensor. Foot फक्त वर तुझ्याकडे वर. जर खाली 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 माझ्या हातावर. Flexors. Then you have to see the extensor hallucis longus. Ask the patient to raise the thumb. Great toe up. Zorat. This is accordingly which lumbar nerve is at fault. You can check on the basis of this examination. These are the clinical aspects of checking the strength in the muscles of upper extremity, lower extremity, whether spondylosis is there, whether this problem is there, where exactly the site is there. That is another aspect very important in order to understand the pathology. Okay. So generally morning stiffness is quite common in myofasciitis. हे लोक येतात ते सकाळी झालं ना उठताना डॉक्टर this is so severe stiffness मला and you ask अंघोळ केल्यावर किती बरं वाटतं and they hard अंघोळ केल्यावर एकदम बरं वाटतं because the muscles get relaxed immediately by warm bath. Treatment same as the above, followed by when pain stops trapezial exercises. Trapezial exercise, trapezius muscle ला कसा exercise शिकवणार? Ask the patient to make hands straight parallel to the floor and just lift the shoulder. This is how you lift the trapezius. सकाळी 10 दुपारी 10 संध्याकाळी. This is very important. 10 times in morning and afternoon evening. Cervical prolapse intervertebral disc. Just see, treatment is same. Elements from sudden jerk to neck, severe neck pain associated with unilateral, bilateral upper extremity radiculopathy may lead to paraplegia also. Diagnosis, clinical examination, cervical spine epilateral, MRI most diagnostic. Now we'll discuss it while discussing management of lumbar. That already we have discussed. Okay, the way we treat the lumbar disc prolapse, similar manner we have to treat the cervical disc prolapse. Only here you have to ask the patient to go for cervical traction if needed only. If needed, you can ask the patient to go for cervical traction, otherwise not, otherwise same line of treatment, nothing different. Okay. Cervical spondylosis. Again, lumbar spondylosis we have discussed. It is cervical spondylosis, same features, degenerative disorder, common modern era disease, mobile disease. This is called a mobile disorder. Because everyone is looking down and getting the cervical spondylosis, more common. Osteoporotic formation pressing on nerve root causing radiculopathy, neck stiffness, pain, numbness in upper extremity, heaviness and paralysis of upper extremity. Diagnosis, clinical examination, X-ray, cervical spine, epilateral, that you can ask the patient. CT, MRI if degeneration is severe. Treatment, here you can ask if the pain is so severe, ask the patient to go for cervical collar. Cervical collar म्हणजे काय? मानेचा पट्टा कुत्र्याला अडकवतात. It is supportive only in old people. Very important. Don't ask everyone to go for cervical collar. Treatment, symptomatic, constitutional, calcareous fluor, beyond B6, B12. This is cervical collar. This is only in specifically old people you ask. Otherwise, don't ask. Otherwise, it really weakens the muscles of the neck. Trapezius वगैरह सगळे कमी. Cervical spondylosis, when pain stops, follow with gradual cervical and neck exercises to prevent the recurrence. Simple exercise is ब्रह्म मुद्रा. काय नाही, पेशंटला हाताची घडी करायला सांगायची. Ask the patient to look up, then straight, then to the left, and then to the right. No forward bending. This is first. Second, ask the patient to tilt on right side, left side. पेशंटला असं सांगायचं आणि हे सांगताना हे सांगायचं की पेशंट काय म्हणतो, पेशंटला वाटतं आपलं टेकत नाही, तो पण असं व्हायचं. He should not. That is, don't tell them that you just try. It never touches. But stretch that. किती ताणायचं? दुसऱ्या बाजूला रग लागेपर्यंत. So aching should be there. रग लागणं म्हणजे aching pain. इथं रग लागेपर्यंत. This side, this side. This is simple exercise for the cervical spondylosis along with trapezium exercise. Is it clear? Yes. Last disorder, thoracic spine disorder. Last disorder. Most common pain at the thoracolumbar region. Thoracic disorders मध्ये दोनच महत्त्वाचे. There is a pain in thoracic region. Thoracic म्हणजे कुठं? पाठ दुखते. Patient complains not कंबर दुखते, पाठ दुखते. Principles precipitates due to the continuous sitting in improper position. आपण कसा अभ्यास करतो? कॉटवर बसून करतो, पुढे वाकून करतो, पाय झोपून करतात, माणसं झोपून तोंडावर पुस्तक तसंच पडलेलं असतं. These are all things where the postural backing, thoracolumbar backing starts. And sitting, आपलं sitting पण असं असतं. We used to sit. Actually, one should sit like this. This is how we sit. This is the reason why thoracolumbar backache is there. Diagnosis is clinical. Postural backache, simple treatment. Management is very simple. Hot fomentation. Don't allow to lie on foam bed. Foam bed वर झोपायचं नाही. Foam bed म्हणजे काय? जी मोठी स्पंजची गादी असते ना, त्याच्यात असा झोळ पडतो. This happens like a concave curve. That creates a problem. So साधी जी आपली कापसाची गादी जुनी असायची, that helps in two ways. That cotton itself is hot. त्याच्यामुळे गरमपणा राहतो. That is good. So when pain stops spinal extension exercises. Generally symptomatic followed by constitutional remedy. What's disease? What's disease म्हणजे काय? पोट आलेलं. What disease is tuberculosis of spine. Chronic thoracic backache असेल, patient is complaining along with weight loss, along with evening fever. आपल्या डोक्यात टिक टिक वाजली पाहिजे लगेच. पेशंटचा वेट लॉस होतोय, फिवर वाढतोय, संध्याकाळचा फिवर येतोय आणि पेशंटला क्रॉनिक thoracolumbar backache आहे, thoracic backache जास्त आहे. Hot spine आहे का? Cold abscess आहे का? The abscess which develops over there is cold abscess. You must think whether patient is having cold abscess. So this is very important. Here the compressed vertebra gets compressed because of tuberculosis of vertebra, and pus develops, and pus due to the gravity it goes backside in the psoas muscle because there is space, and in the psoas muscle that was gets saturated, that is called as psoas abscess or cold abscess, because it doesn't have any inflammatory signs. That's why it is called as a cold abscess. Okay. So diagnosis, clinical examination, X-ray, thoracolumbar spine, epilateral, MRI, diagnostic. This is MRI where you can see the abscess collected over there in the psoas muscle, bilateral abscess in psoas muscle. One short case, Manani San, so it is not written over there. A patient was admitted in Bagli Hospital. It was 1990, and patient had quadriplegia because of tuberculosis of spine. He had a big cold abscess over there. He was already on 4 months on ATT, 5-drug regimen. Anti-tubercular treatment, 4 mahine chalu hote. And everyone asked him to go for surgery, but he was not ready because he doesn't have strength in both upper extremity, lower extremity, hath halat nahote, paya halat nahote. Sir said to him that treatment in allopathy is surgery, but after surgery we don't give guarantee that he will going to get strength, because already TB treatment is going on since 4 months and there is no result. We don't expect, but still there is a big abscess collected over there. We will drain that after operation. So I asked sir, shall I give homeopathy? He said, why not? Give it. I have read the one booklet, Drosera by M.L. Tyler. She has written 10 cases of tuberculosis spine treated with Drosera. So I have used in that case Drosera as a remedy along with other remedies, Calcare, Silicia in that case, and Kali by combination 24, etc. along with Drosera I have used. And the patient was admitted on operated on 3rd day, and nearly about 2 glass of pus was there collected, which was removed after operation. Then there was that degenerated vertebra they have removed, then their bone graft was kept over there, and sir said not possible to get cure. So I was in thought whether our remedies works, and I have given Drosera already started on 2 days, and post-op next day patient started showing his hands are moving, fingers were moving, toes were moving, and when patient was discharged on 10th day he was able to walk on crutches. Sir said it whole credit goes to homeopathy, it is not because of allopathic medicine. That was the case. So this is the line of treatment, absolute bed rest to prevent kyphoscoliosis. Very much chance kyphoscoliosis develop होण्याचा because of tuberculosis of spine. Patient ला असं येतो. That is always because of tuberculosis of spine more commonly. High calorie nutritious diet is needed, protein द्यावं लागतं tuberculosis केसला. Exercise in lying down position to prevent thromboembolism and maintain strength. Patient झोपलेल्या अवस्थेत असतो, and thromboembolism, they are commonest things which happens when patient gets heart attack. So non-weight bearing exercises in lying down position, पाय जवळ घेणं, पाय लांब करणं, so keeping extremities जवळ करणे, pulling the extremities, making them strain, then pressing the knees down, then moving the fingers. These are common exercises patient should continue for such types of cases. Very perfect simillimum depends upon detail. History, biochemic, Calcarea POS is wonderful remedy along with 5 POS, B1, B6, B12. Read Drosera. This booklet is small booklet is there. My suggestion, read that book. She has explained the cases cured. And when strength returns, gradual sitting, standing, walking exercises. Coccyx disorder, single disorder is there which is called as coccygodynia. Coccygodynia म्हणजे काय? Patient comes and doctor माझे माकड हलायला लागले. ते आजकालचे लोक ते स्टँडर्ड असतं ते म्हणतात माझा मंकी बोलतो. They always talk like this. They talks like this. They talks like tailbone. This is pain. This is coccygeal disorders are condition that affects the tailbone or coccyx, the surrounding area. Symptoms include pain, swelling, redness, and difficulty in sitting. Very important is sitting is very difficult for these people. The most common cause of coccygeal disorders is trauma, such as falling on a hard surface. Many of these causes involve disorders of anatomic structures near the coccyx rather than coccyx itself. Coccygodynia refers to the pain in and around the coccyx. This is with patient can come. There is no treatment in allopathy. What do? Painkillers never works because they never reaches over there. They give steroids in that coccyx. That is the only steroids in the coccyx. It works for 3-4 months. Again, patient gains the pain. That is the only treatment available in allopathy. We can treat it with homeopathy. If you open, this is complete repertory, pain, coccygodynia from. There are multiple subrubrics. But if you take it from trauma, these are the remedies like aloes, bambusa, carbonilis, causticum, crocus, hypericum, kaliiodide, mezereum, natrum, ruta, silicia, and thuja. These are the remedies which are mentioned for it. So we have good remedies and we have very good remedy. Patient always indicates this pain with the tip of fingers. Kali which one should not forget. Kali which is wonderful remedy in coccygodynia. So that's all in short regarding the role of homeopathy in spinal canal disorders. What we learned today? We learned this is the real homeopathy, the divine science. And thank you, Dr. Samuel Hahnemann and homeopathy, because of whom we are gathered together. And this is what I always use this line from Swami Vivekananda. If man goes towards what is false, it is because he cannot get what is true. Therefore, the only method of correcting what is false is by supplying him what is true. Do this and let him compare. You give him truth step by step, and there your work is done. And I follow these steps. So thank you being there. Those who have not yet joined our channel should join the Divine School of Homeopathy. Yesterday, on the occasion of Guru Datta Jayanti, we have reached to 10,000 subscribers. It was a big issue in homeopathy that 10,000 homeopaths getting joined. That is another 862 videos uploaded up till now from organon, materia medica, repertory, varieties of disorders and homeopathy. So it is open to all of you. You don't have to pay anything. Just subscribe and join. A platform, the Divine School of Homeopathy. This is the platform. This our school, virtual school's name is the Divine School of Homeopathy. Platform for everybody and to develop oneself as a homeopathic physician. Be a life member by paying just once 500 rupees. You can become a life member of our institute, and to my number 9890168872. You can anytime become a member. Thank you being there. And thank you to all students who came right from the Srampur. It's a big thing that they have come from that place to Sangamner to learn something. Second important thing, give him a big clap to Now I will just last 2 minutes I will ask the Rutuja to complete the session.
जास्त वेळ नाही घेणार आहे मी. काहीतरी लिहिलंय विचारांसाठी. साखर झोपेत असणारे आम्ही कडकडून उठलो. पंक्च्युअलिटी काय असते हे तुमच्याकडूनच शिकलो. होमिओपॅथी शिकणारे आम्ही नेहमीच रिग्रेट करत राहिलो, पण तुम्हाला बघताच डेडिकेशन काय असतं हे तुमच्याकडूनच शिकलो. सर, तुम्ही नख सारखे इंडस्ट्रियस आहात तर ऑरेंज सारखे प्युअर आहात. आपल्या पॅथीबद्दलचा असलेला विश्वास आणि प्रामाणिकपणा तुमच्याकडूनच शिकलो. सर, दिवसाची सुरुवात आणि दिवसाचा शेवट हा तुमच्याच लेक्चरने होतो. कधी नाही झालं लेक्चर तर दिवस व्यर्थ झाल्यासारखं वाटतं. देणारा हा नेहमी निस्वार्थपणे देत असतो. पण फक्त असावी लागते ती म्हणजे घेण्याची भावना. म्हणूनच कवी दीनदा करंदीकर लिहितात, देणाऱ्याने देत जावे, घेणाऱ्याने घेत जावे, घेणाऱ्याने घेता घेता एक दिवस देणाऱ्याचे हात घ्यावे. या कवितेप्रमाणेच आजचा हा सेमिनार द स्पायनल कॉर्ड डिसऑर्डर आदी बॅकबोन ऑफ होमिओपॅथी ठरला आहे. खरं तर आम्हाला समजलेल्या होमिओपॅथीचे बॅकबोन सर तुम्हीच आहात. स्पायनल कॉर्ड डिसऑर्डरचे सखोल ज्ञान आणि मॅनेजमेंट हा अभूतपूर्व अनुभव असून एक डॉक्टर म्हणून समाजात वावरताना आम्ही याचे पॉझिटिव्ह इम्प्लिमेंटेशन नक्कीच करू आणि डेअर टू बी वाईज बनण्याचा देखील प्रयत्न करू. आजच्या या सेमिनारच्या माध्यमातून होमिओपॅथी बद्दलचा विश्वास आणि स्वतःवर असलेला आत्मविश्वास हा दृढ झालेला आहे. And last but not least, thank you so much, sir, for delivering us a marvelous seminar. And thank you, all my dear friends, for attending the seminar silently and sincerely. Thank you.
So dear friends, you have nearly about sat over here 3.5 hours. In college, it is not possible. I think so. But you sat over here silently, listened everything. I have prepared one picture in front of you regarding one disorder. मी माझ्या हाताने एक चित्र काढलं. There might be some wrongs, there might be some faults. It is your duty to fulfill that. So it is not possible for me to go ahead alone. All of you are needed to go ahead and build our pathy as a number one pathy. So for that purpose, I suggest all of you to join this activity, which is not at all any painful, or you can say it is not. You don't have to pay anything for that, but you have to pay your time for that, and you can learn the homeopathy. So to conclude the session, सारे मिळून चालूया, सारे मिळून गाऊया, सेतू बांधारे सागरी, सेतू बांधारे सागरी. So we'll meet next time as early as possible. Okay, with some other disorders.